Recording in progress.
There will now be a moment of silence or meditation. Thank you very much, honorable members. Be seated. Honorable members, let me take this opportunity and greet you, and as well as those who have joined us through the visual platform. You are welcome. And our special greetings to our Minister of Social Development. This would be her maiden speech in the House. And we also want to take this opportunity, Minister, and congratulate you on your responsibility that has been bestowed in you. We wish you all the best in your endeavors as the Minister. This is your house, this is your home. Do feel free to engage with the honorable members and as well, by and large, most importantly, the broader masses of South Africa. They are yearning to hear what is it that you will be doing to better their lives, and more so, you know, your fragile, vulnerable community that you are looking after. They are looking at you as their mother to speak to them from time to time. We're saying this is your house and this is the platform in which you can convey whatever that you want to say to the community. Having said that, once again, we thank you. We thank you for coming through so that you can speak to your people. Honorable members, I would like to remind the delegates that the rules, in particular, sub-rule 21, 22, and 23 of Rule 23 apply in this setting. In accordance with the Council Rule 229, sub-rule 1, there will be no notices of motions or motions without notice. Honorable Delegate, before we proceed to questions, I would like to take this opportunity to welcome Ministers of Social Services cluster, specifically the Minister of Health. I'm told that he will be joining us later through the visual platform, as well as the Minister of Social Development, who is here with us, as well as all permanent delegates, the MECs and special delegates, and SALGA representatives to the House. Further, I would like to remind delegates that in terms of Rule 229 of the Council rules, the time for reply by the ministers to a question is 5 minutes. Only 4 supplementary questions are allowed per question. A member who has asked the initial question would be the first to be afforded the opportunity to ask a supplementary question. The time for asking a supplementary question is 2 minutes per member. The time for reply to a supplementary question is 4 minutes. The supplementary question must emanate from the initial question that was asked. Honorable members, I now call upon the Minister of Social Development to respond to question number 128 as asked by Honorable M.S. Ndlovu. Honorable Minister, the podium is yours. Nalibongo.
Good morning, Honorable Chairperson of the most important house in the Republic of South Africa, the Upper House, the honorable members of this august house, colleagues in the platforms. I must first by appreciating your good words of congratulations to me, Honorable Chair. I really appreciate them and I really welcome them on behalf of your constituency. Honorable Chair, whilst the level of social ills is increasing in the country because of the scourge on pervasive social ills, including gender-based violence and femicide, the numbers of social workers are not enough to respond to the scourge. And therefore, Chair, the government's commitment through the National Development Plan Vision 2030 to strengthen and expand the number of social service professionals in government. They are now currently have employed 23,561 social service professionals. And these professionals are categorized as follows: social workers, social auxiliary workers, child and youth care workers, community development practitioners. Out of 23,561, the Department of Social Development employed 18,948 with the following breakdown. The social workers are 11,070, social auxiliary workers are 2,822, child and youth care workers are 2,517, as well as community development practitioners, which are 2,538, and that gives 539, I'm sorry. That gives us a total of 18,948. Chair, from the 23,561, the bulk of employment in social workers at 11,070 are employed by the Department of Social Development, and 4,326 social workers are in the employment of other government departments. These social workers, Honorable Chair, are providing psychosocial support to address the scourge of social ills, inclusive of gender-based violence and femicide. Chair, in realization of these pervasive social ills, the department, in partnership with other government departments, developed a strategy for employment of social service professionals, which has been approved by Cabinet. The department initiated this workshop together with other government departments, the regulatory bodies, the institution of training and development, to engage on the possible opportunities for employment and funding of social service professionals, including social workers. Honorable Chair, that workshop resolved on a program of action with a clear deliverables and timelines. This is to guide the implementation of that strategy. I thank you, Honorable Chairperson.
Thank you very much, Honorable Minister. The initiator of the question was Honorable Ndlovu. I will now afford her an opportunity to ask a follow-up question.
Thanks, Chairperson, and thanks, Honourable Minister, for your elaborate response to my question. It is very encouraging, Honourable Minister, to hear that the department has a clear strategy for the employment of more social workers. Honourable Minister, I think the public is having a problem with all of us to say every now and then we are talking, but we don't come with a time frame. So if we can just indicate to the public, when can we, the time frame and the implementation of the strategy?
Thank you.
Over to you, Honorable Minister.
Thank you, Honorable Chairperson. Thank you, Honorable Ndlovu, for a follow-up question. Honorable Chairperson, the approved strategy of employment of social workers, social service professionals will be realized and implemented through a developed program of action that will start from 2025 financial year until 2030. This program is responding also in the National Development Plan Vision 2030. And what is good about this program, Chair, is that because as DSD, we cannot be able to really employ all the social workers that our society demands at the present moment. And this is the reason why we got into this partnership. And as you would know that we are almost at the tail end of this financial year, which is 23-24. We are going to get into 25-26. And this strategy will be start to be implemented in the 25 2026 up until 2030 financial years. Thank you so much, Honorable Chair and Honorable Ndlovu, for the follow-up question.
Thank you very much, Honorable Minister. And the next follow-up question is from Honorable Adrianse from DA.
Good morning, Minister. Minister, your deputy's response to the NCD pandemic on 16 September 2024, and again in the NCOP today, maybe, included a call for a collective action from all sectors of society, not just government. Whilst this is indicative of your realization that government and its draconian, unimplementable and unfunded NHI alone cannot attend to all South Africans' medical needs, how will this collective action be achieved when you are continuously and aggressively vilifying private medical schemes and who have the necessary resources to prevent, detect and effectively manage NCDs? Thank you.
Honorable members, we can't preside all of us.
Honorable,
Now, Honorable Andriense,
I was on the wrong question.
I have afforded you an opportunity to ask the minister a question. So you just made a broader statement without a question. Hence, the minister will not be at liberty to respond to what you have asked. We take it as a general statement that you have made, and we are good with that. That's fine. The next question
Chair.
then.
Honorable Chair, she just made a mistake. She asked the wrong question.
No, Honorable Badenhorst, can you please take your seat? You can't speak on her behalf. She's a member in her own right, and therefore she had a liberty to express her views. As a result of that, she was given an opportunity. Now, she said what she wanted to say, and as a leader of the party, you are responsible to whip your members, but not to whip the house in the house. So you'll sort your problems outside the house. We are here continuing with the business of the house. As a result, Honorable Member, I take it that we've learned something out of this. Next time, we'll do it a bit better. Don't worry, don't stress. There's tomorrow for you to do that. If you don't have a question, Honorable Member, there's nothing wrong to say that you are being fully covered. You're allowed to do that. And basically, the question you must ask the question, not substantiate of whatever that has already been said by the minister. The order paper is very clear. You ask follow-up question from the initial question that was asked and subsequent response that has been given by the minister. That is what is expected of us. So in the absence of that question, Honorable Member, it's not like you've made any, you've killed someone. So we'll then move to Honorable Makesini.
On a point of order. Point of order, Chair. Thank you, Chair. Point of order.
There's point of order. You're raising on rule. What, Honorable Member Pili?
On Rule 37, Chair.
Rule?
Rule 37. Chairperson,
Okay.
in terms of the order paper, we were supposed to begin with the Minister of Health. And we've now changed that and starting with the Minister of Social Development. And I think the mistake that was conducted by the Honorable Adriansa was based on the assumption that we're going to begin with the Minister of Health. And she made—
Honorable Billy.
Can I finish the point, please?
Okay.
She made a very innocent mistake because she was of the opinion that the first question was directed to the Minister of Health. And it's a technical mistake that she made. She read an incorrect question, not to make a statement. She wasn't intending to make a statement. She went to the wrong page because she was of the opinion that we are following the order paper. And I think it is
Chief Whip, I think it's a very fair, honest mistake that she made. And I think it is upon you, Chairperson, that you allow her to ask the question that she wanted to ask.
Honourable
It's
Daly,
my request, Chair.
I think you have made your statement, and I hear you and understand that it's an honest mistake. Nobody's refuting that. Let's not make drama out of nothing. As you would recall that when I started here, I did indicate that the Minister of Social Development is the one to start. And the honorable member was in the House when that was said. And when the honorable Minister of Social Development took a platform. So let's not make a halapalu. Nobody is accusing her of whatever the case might be. And as I am saying, her time is up. I can't reinvent yet another new time. So I understand fully. And I'm not opposed to what has been said. I fully understand what we are saying. I did make an indication that we will start with the Minister of Social Development. It was not concealed. It was said, and I fully understand what you are saying. Hence, I'm saying to the member, don't worry, all is not lost. I do, and I fully sympathize as well with her. I understand. So let's not fight over nothing. Please, honorable members. Honorable Fanny, you're raising on?
I'm raising a point of order, Chairperson, in terms of rule 6(9), sub-rule 12. Chairperson, I think the House must acquaint itself when the order is being made by the Chairperson. It must be respected and also adhered to, so that we don't find a situation of a dialogue, especially of certain members here. At least we must be able to adhere to this rule for the progress of the sitting. Thank you very much.
Your order is sustained, honorable member. That's how things should be done in the House. But sometimes some members, we just need to be patient with one another and teach one another. So in line of doing our work, some will err. And your point of order is sustainable. And we need to maintain the decorum of the House. This thing of disagreeing, even if when the rule is being made, it is just not on, honorable member. And I see there's a tendency that is happening. And Honorable Badenhorst, please don't speak on behalf of other members. Honorable Andrianse can speak for herself. And therefore, as a result of that, I expect her to do that. Thank you very much. We're wasting time. I'm now moving to the next speaker, which is Honorable Makesini.
Thank you, Chairperson. Itindibulise mama. Sesivile utshilo wathi i-social worker asinazo azikho ninzi azifumane kuba zingakhava zonke iiproblem esinazo kwi-country. But i-follow-up question yami ibuza ke ngoku, how do you ukwenza i-coordination yakho namapolisa ne-Department of Health get a social worker onazo ezingekho enough, because regardless of the challenge, we must still assist our people. I-coordination and working relationship with the Department of Health and the police niyenza njani? Ndiyabulela.
Thanks, Honorable Makesini. Honorable Minister.
Thank you very much, Honorable Chairperson. Thank you, Honorable Member. Honorable Chair, as I've indicated that some of the social workers are in the employment of other departments, like the Honorable Members have alluded and articulated that. However, because we are dealing with the same constituency, for instance, when there's a rape victim, there's no other way to get into there except for getting into where the victim is, or the victim will submit herself to where either in the police station or in our centers. And this is where we're working together in making sure that the life of the victim is made more easier for her to be taken through all the necessary and known processes for her to be able at the end to register his or her own case, because that's what we would want to see at the end. However, because of our being part of that process, we're also able to process him or her in other services that we have. I am assuring the honorable member to say, in the centers, in the police stations, we have a very clear working relationship. To an extent, we have developed a policy that seeks to make sure that there is uniformity in that regard. Remember, honorable member, in some cases, not only social workers are operating in that space, there are other NPOs that are quite important that are assisting our victims. And in that regard, the DSD has initiated a process of developing a policy wherein we are discussing and already in the implementation of that policy to make sure that when we're dealing and assisting those victims, there is uniformity so far as the laws of this country are concerned, but also to the fact that the victim does not become victimized furthermore in being part of those centers of ours, either in the police stations or in the centers where they can get assistance. I want to assure the honorable member that that work is in place and the coordination is there because the policy has been introduced by DSD and we're working very well with other departments that are relevant in this regard. I thank you, Honorable Chair.
Thank you very much, Honorable Minister. I'm now moving to Honorable Nobo from MKP Party.
Thank you, Chair. Honorable Minister, the Department of Social Development, DSD, in South Africa is facing challenges in maintaining a sufficient number of social workers to effectively address the high levels of gender-based violence, GBV, and other social issues. These challenges stem mainly from budget constraints, misallocation of funds, and ineffective recruitment strategies. The question, Minister, is, could the Minister please explain the factors influence the department's multi-year budget plan in determining budget priorities, such as filing priority posts? If those factors do not play a role, how that budget allocation made for filing these key positions? Thank you.
Over to you, Minister.
Thank you, Honorable Chair, to the honorable members. Indeed, the finances are not enough for us to be able to employ the professionals insofar as that factor is concerned. And hence, in my earlier response, I then alluded to the fact that the department has coordinated all other departments under one roof, wherein they all discussed and agreed on the strategy on how are we going to make sure that we are able to appoint as many social workers as we can, regardless of the fact that indeed, as in the globe and in the country in particular, the budgets are shrinking because the fiscus is not so enough because of all what we understand that the economy is not doing very well in the globe and in our country. However, the DSD had this initiative of coordinating all other departments who has potential to employ more social workers. And hence, in the earlier response, I then say in the new financial year, which is 25-26, we are targeting to employ more as DSD. I can't speak on the projections for now, Chair, but also we are working closely with other departments who themselves, like SAMS, who are in dire need of those social workers. However, Chair, we did not only stop there. We have been able to recruit other funders who has interest in the fight of gender-based violence and gender-based violence and femicide, but also in the eradication of poverty. We have very good relationship with those, and we are now in the same page in the recruitment, in the training, in the distribution, and in the mobilization of resources. That's the strategy that we are deploying at the present moment. I thank you, Honorable Chair.
Thank you very much, Honorable Minister. We've now exhausted this question. We are now moving to the next question, which is question number 137, as asked by Honorable Du Plessis from DA Gauteng. Over to you, Minister.
Thank you very much, Honorable Chairperson, and to the Honorable Member who have raised the question. Chair, the main role of the Department of Social Development in the Victim Empowerment Program is the provision of psychosocial support services as outlined in the provision of the National Policy Guidelines for Victim Empowerment. Our department has since developed the intersectoral policy on the provision of that psychosocial services for victims of gender-based violence as a framework to guide provision of services to victims of those crimes. Our department, Honorable Chair, is currently capacitating stakeholders and service providers on this policy as part of improvising the quality of service delivered on the victims of crime and violence. The DSD is also planning to establish more victim empowerment centers, including shelters in all provinces, as part of ensuring that all districts in South Africa have shelters by March 2029. Chair, the DSD is in the process of developing a memorandum of understanding with South African Police Services for the provision of social support in the victim-friendly rooms. And this memorandum of understanding between DSD and SAPS will be signed by March 2025. Chair, SAPS is responsible for ensuring sufficient rape kits for victims of social violence. This is the mandate of SAPS, not DSD. However, DSD is also mandated by Domestic Violence Act to share the updated list of shelters with SAPS and other stakeholders annually. And our department has developed a national resource directory of services for victims of crime and violence. And this national resource directory is shared with all the relevant stakeholders, including SAPS, for referral purposes. Our department has developed the training and development plan for the victim empowerment sector, which seeks to guide the implementation of training initiatives for the justice, crime, and security cluster. Our department, in line with the implementation of the National Strategic Plan on Gender-Based Violence and Femicide, this is what we are doing, Honorable Chair, in line with the question of the Honorable Member. I thank you.
Thank you very much, Honorable Minister. Then I'll now give this opportunity to Honorable Du Plessis from DA to make a follow-up to the Minister.
Thank you very much, Honourable Chair. Thank you very much, Honourable Minister. With the understanding of the complexities of intergovernmental relations with this scourge we see in society, I'd like to ask, this problem has been discussed for almost 10 years on a national level, with various solutions very similar to the solutions we've heard today. What makes this undertaking implementable? And how will we ensure that this is not another empty promise to the vulnerable in society? Thank you.
That was short and sweet. Honorable Minister.
Chairperson, thank you. Indeed, I would agree with the Honorable Member about the rhetoric. However, I want to note that in the 2024, the President of the Republic do promulgate a law now that is dealing direct with the gender-based violence and femicide. This was a historical move because for all these years and all the time, we've been talking about issues of gender-based violence. We have never been able to come closer and develop a law that will deal with that decisively. And as such, now we have collated all the relevant laws and regulation that talks to confrontation of gender-based violence and femicide. And now we are now given and assigned that responsibility by now the law, not only talking for us to be able to do that. And in this case, the DSD is in the center of that and we are coordinating everybody. Hence, I was talking about the role of each of one of us, the role of SAPS, what we have established, because in no time, Chair, we are expected to report both in the country and for Vision 2030 on the progress that we have made. Remember, Chair, this has been raised by the society. It has never been out of our own wisdom. We spoke about it for the longest time. However, the society itself took upon itself to make sure that a law is now promulgated that deals decisively with the gender-based violence and femicide. This was exposed with the sketch that we went through as a country of COVID-19, where the numbers escalated dramatically, hence this move. I want to commit in this House, Chair, that as GST, we are responsible. However, we will be championing this because it is within our interest to make sure that majority of this country, which are women, must be safe in the streets and their homes. I thank you, Honorable Chair.
Thank you very much, Honorable Minister. The next question is from Honorable Mukwele from ANC. Over to you.
Thanks very much, Chairperson, and greetings to the Honorable Minister, Prelude Medici. Honorable Minister, first and foremost, let me thank you for your response for the question asked. My question to you, Honorable Minister, is that what kind of training is your department providing to its official and civil society organization in dealing with this complex situation? I thank you.
Thanks, Honorable Mukwele. Over to you, Honorable Minister.
Thank you, Honorable Chair. As I've indicated that as DSC, we took it upon ourselves to develop a policy that deals with that training. And as such, the policy is in existence and we are coordinating, we're taking through our officials and other departmental officials to make sure that they are aware of the policy because they are the implementers, but also there are other NPOs that are quite important in our society who are also in assistance in dealing with this matter. And hence, those workshops are taking place at the moment wherein we're taking all the interest groups through those trainings. It's an extensive training because it deals with the victims that are quite sensitive to deal with because of their vulnerability. But also, Chair, we are making sure that the awareness in this regard is being made because not only should be the victims that must be aware and the officials, but also to deal with the sketch, the society must be made aware of why we should be dealing with this from homes, from the society and all walks of life. I thank you, Chair.
Thank you very much, Honorable Minister. We are now moving to Honorable Shira Mpungose. She's not in the house. It doesn't seem like she's also on the virtual platform. And she then forfeits this opportunity. We are now moving to Honorable Briat. She may do that by making a written submission to the follow-up question if she needs to do that. But we're not going to revert back to her. I'm
on the system. I'm online, Chairperson. But I'm here online. Can I still ask the question?
Yes, can you switch on your camera, Honorable Shira?
Chairperson, I'm having connectivity issues here. I'm en route. So please allow me to ask the question.
Yes, definitely go ahead, Honorable Shira.
During NCOP week in Gauteng, delegation went from Rastafari Secondary School and then to Kopanong Hospital. Both projects were incomplete. What was alarming is that during the engagements with the departments, it was brought to light that it was the same contractor that was responsible for both facilities in different departments. Why is the minister utilizing contractors who have a reputation for not completing projects? Why hasn't the department blacklisted these contractors? And what action has been taken against the contractors who are notorious for not completing projects? Termination of contracts isn't sufficient and should no longer be cited as a consequence management tool.
Thank you very much, Honorable Chira. I'm a contractor minister, but pendula ngawo ke kasasa. Ogogo sebanama contract.
Thank you, Honorable Chairperson, and to the Honorable Member who've asked the question. Chair, I guess once I'm a Minister of the Department of Social Development and its entities, I can only account on our mandate as per the Constitution and the 7th Administration Directives. But this one, Chair, I want to profusely apologize that it's not relevant to our mandate. I thank you.
Thank you very much, Honorable Minister. It's within your right, as we've indicated, that you ask based on the initial question that was asked. And if the follow-up is not in line with that, then it's a new question which must be submitted officially. Honorable Brett, this is your turn to ask a follow-up question.
Thank you, House Chair. I hope I'm audible. House Chair and Honourable Minister, sticking to interdepartmental relations and working collaborations, what actions will the department take to improve collaboration and support from municipalities, especially in big cities like Johannesburg, which do not offer utility rebates or prioritise housing for GBV survivors? Thank you.
Thank you very much, Honorable Brett. Honorable Minister.
Thank you very much, Honorable Chair, and from the Honorable Members. Chair, I want to indicate the fact that that question is responded to by the fact that we are now in partnership with Department of Public Works, which is the sole department that has the responsibilities with the government properties. And in this case, this is where, in line with the act that gives the public works that responsibility, we are able to work with them. And we must report in this house that they've already, a part of us, they've identified, and they've also agreed on a budget that seeks to refurbish those properties that they are going to be assigned to ourselves. We are working with the department chair as our sister department, as according to the Constitution of the Republic, because this is when we can mitigate between each other's budget, each other's role, but also in the partnership we have, because the gender-based violence and femicide is a call upon all other departments to contribute. We have not reached a stage where we work with direct provinces, which this is where we are getting, Chair. Remember, this is new, and this law that makes it compulsory for all of us to work together has been promulgated just on the eve of the 29th of May. This is new, but this is not an excuse. I want to record a lot of progress that we have made in this regard. Yes, indeed, gender-based violence happen in homes and villages. Therefore, it's important for us not only to be in districts, but only in wards and where people are, which are VDs. We hope we'll get there. However, for now, we are still at the process where we're working with other departments and work with the provincial departments of DSD for them to intensify the IGR concept and DDM, where we'll be able to all reach the actual victim where she is. I thank you, Honorable Chair.
Thank you very much, Honorable Minister. We have exhausted this question. We are now moving to question number 129, which is asked by Honorable Sibande from ANC. Over to you, Honorable Minister.
Thank you very much, Honorable Chairperson. Honorable Chair, thank you to the Honorable Member for the question. Chair, the National Development Agency is an agency of government that is central to poverty eradication agenda and reports to Parliament through Department of Social Development. This is NDA was established in November 1998 by the National Department Act of 1998, which is Act 108 of 1998, which is called NDA Act, as government's response to the challenge of poverty and its cause in South Africa. The agency, Honorable Chair, is classified as a public entity under Schedule 3A of Public Finance Management Act of 1999, which is Act number 1 of 1999. Chair, the legislative is like this. The NTA has a primary and secondary mandate, that is to discharge its responsibility of eradicating poverty as well as its causes. These mandates are: 1, the primary mandate of the NTA is to contribute towards the eradication of poverty through the CSOs, which are given a responsibility to implement development projects in poor communities and granting funds, which is done by the NTA, to build the capacity of community organization to implement development projects in our poor communities in particular. Chair, the second secondary mandate of the NTA is to promote dialogue between the communities and the relevant organs of state, as well as to promote debate on policy development. The NTA, as according to this law, must undertake research and publication aimed at providing the basis of development policy. And Chair, it is also important to note that the NTA board, which is in existence, took a decision in 2023. It also approved a turnaround strategy that is aimed at increasing the impact and the visibility of the agency in the overcharging of its responsibility and its in the environment. The turnaround strategy adopted the sustainable development model as an approach to poverty eradication in line with priority 2 of the GNU government in the 7th administration. Chair, the NTA is making progress in the implementation of sustainable livelihoods intervention for poverty eradication, which are implemented in poor communities to create sustainable local economies. As alluded to earlier on, this is a new approach, Chair, that we are implementing because it's a directive of the 7th administration, and the second one, it is called Reduce Poverty and Tackle the High Cost of Living. And to this end, Honorable Chair, we can proudly register to this House that the agency has identified 22 poorest wards in collaboration with State South Africa. These wards have been selected, Chair, through the data and assistance of State South Africa. And these wards have been identified as the ones that have got severe multiple deprivation. We also prioritize these wards and based on our capacity to deliver quality service and the limited resources available. However, going forward, our plans are to increase this number and include more wards by forging partnership and mobilize additional resources to benefit more poor communities. These 22 wards, Honorable Chair, that the NTA is working with were engaged in a variety of enterprise sectors, including but not limited to manufacturing, agriculture, and agro processes, garment making, tea making services, and so forth. An amount of 25 million, Honorable Chair, has been raised from strategic partners to fund the COs in realization of the fact that ours, which is part of our government, is not enough to conduct this important responsibility. Chair, we must mention that we have managed to forge partnership that provide equipment and processing machinery for small enterprises with training program for using and managing the equipment. Our agency, which is NTA, is also assigned a similar agreement with a partner in the construction industry using practical, innovative, and sustainable approaches that benefit the community through their cooperative model to address the housing backlog in South Africa, which then makes the society and our people to contribute on their plight, but not wait for hand-ons from government. Chair, the NTA assigned agreements. It has signed agreement with SETAs on technical training and mentoring. The NTA also entered into a training agreement with a German cooperative umbrella body to train and mentor cooperative on the principle underpinning cooperative and proper government of cooperatives. I thank you, Honorable Chair.
Thank you, Honorable Minister. Honorable Smande, it's your opportunity to ask the follow-up question.
Thank you, Minister, for your marvelous and tremendous response. It will be interesting to know where the 32 identified wards are located in the country. Will the Minister please supply us with the list of wards? Thank you.
Honorable Minister.
Thank you very much, Chair, and thank you from the honorable members. Yes, Chair, as I've indicated that the wards are in provinces, they are in district and municipalities, they are ward themselves, then they are part of the villages. They are also in town and farm areas. Chair, we can make mention of the fact that these wards, Amatole has benefited out of this because of the fact that Amatole has just been identified by the state South Africa that there are elements of an area where malnutrition has been identified, which becomes strategical for our department and NTA to participate in this regard. In Krisani, Chair, we have made inroads on the Krisani in the municipality of Emalahleni, Chair, in the OR Tambo district, in the Moza local municipality, we have this ward identified. In the Tabo Mufuzanyana, in this, there is this ward in Pofong municipality, Chair, in district, in Kharib municipality, these wards are there in the Kopanong municipality, Mfuleni, West Rand, Honorable Chair, Amajuba, Mzinyati municipality, Umgungundlovu, Mopani municipality, Egiani, Shangaphambili Sikhukhuni municipality, Makutu Tamaha does have that ward. Evembe, Honorable Minister, Shanzeni, we have that ward. Honorable Minister, Bushback Ridge, I can make mention of that, of the fact that there is that ward. Shanzeni District Municipality, Mkomazi Municipality, Che Ngagamudire Mulema Municipality, there is that. Dr. Ruth Khomotse Mupati, we do have that. Che Kahisana local municipality, in the Pixlika Summit District Municipality, Msobomvu Municipality, Chair, Francis Park District in the Northern Cape, Chair, in the Western Cape, in Winelands, Cape Winelands District Municipality, we have that in Stellenbosch, as well as the West Coast, Honorable Chair, where in Cedarburg, we have these. These, Chair, are made up of 130 human settlements, wherein we've been able to have these wards. Yes, Chair, we have a strategy to grow and be in most areas. However, due to limited resources, we're unable for now. However, we hope and are assured with our partners, private partners, as well as other departments, this will be adhered to within no time. I thank you, Honorable Member.
Thank you very much, Honorable Minister. You know your provinces. The next question is from Honorable Skier Kocha from DA. Son is an active member.
Thank you, Chairperson. Minister, the importance of intergovernmental relationships is at the forefront of this administration. Is the Department of Social Development engaging with other spheres and departments to ensure that the socio-economic ills in South Africa is addressed?
Thank you very much, Honorable Minister.
Thank you very much, Honorable Chair and the honorable members. Indeed, Chair, the National Department can't move without both its partners because we are a three-sphere government in South Africa, which therefore means that we can't reach a ward or a local municipality without getting involved in a partnership that is meaningful. We're first with your sister departments, which have demonstrated this in the earlier responses, wherein we are working closely with SAPS because we are in charge of the fighting of gender-based violence. We are working with Public Works because they have a responsibility to make sure that there are premises and properties to do this work from. 3, we're working with other departments that are relevant, the Department of Agriculture, because if you want to deal with hunger and poverty eradication, DST can't do it alone. We're working very close in a very meaningful way in the partnership. The Chair, I've just alluded to the fact that as DST, we have just developed and implementing a policy that seeks to make sure that we're working together as government to make sure that we take that process and to provinces and district wherein we can have a meaningful impact in changing our lives of our people. Chair, I want to assure this House that there's nothing that the Department of Social Development alone at head office or national can do without provinces and district. And hence, I've just demonstrated in all my responses to say we are working closely with those. And Chair, I want to assure the House that we don't have a choice. People are in provinces, people are in district, people are in local municipalities, and people are in their wards. Hence, in our development strategy, NTA as our entity did not go anywhere else except to go direct and zoom in the wards where this is prevalent and is being experienced on a daily basis. Therefore, Chair, we want to assure the House we are working very close with our sister departments, with our provinces as well as districts. Yes, informed by the IGR and the new developments that makes us to be, it becomes compulsory to work together for a better service provision to our people. I thank you, Chair.
Thank you very much, Honorable Minister. I'm now moving to PA, which is represented by Honorable Farmer. Over to you.
Thank you, Chairperson. Thank you, Minister. We struggle to see how the NDA can eradicate poverty when they are creating poverty themselves. It's a known fact that workers in society who is in the employ of these NGOs are some of the least paid individuals in that society. Close to 90% of them are women. Close to 90% of that women are single parents. So this income is the only income they are dependent on for that household. My question is, the NDA is discharging its mandate has to empower and enhance the capacity of the civil society sector. How is it then that workers who leave the employ of these NGOs found that no benefits deducted from their salaries are paid over to UIF? Thank you.
Thank you very much, Honorable Farmer. Honorable Minister.
Thank you very much, Honorable Chair. Thank you for the question, Honorable Members. Honorable Chair, as the NDA, we fund organized NPOs, which then become accountable for issues of reporting back to the NDA as per the funds that they receive. I guess the advice that I'm getting from the Honorable Members is that the NDA must zoom in to get to understand whether those that are in the employment of those NPOs are benefiting insofar as what the Honorable Members is raising. For them, when they walk home during that time, they can still be able to benefit from the laws that govern this country insofar as labor laws are concerned. I guess, Chair, I cannot give that answer standing here. I can quickly go and find out, but however, I want to assure that the member that we only fund NPOs as per our criteria, but we don't get closer to know who is employed because it's the NPO that directs accounts to us. However, I take the advice, Chair, and the counseling that do look closer into those because sometimes they do happen that they don't get enough, but however, they also don't benefit when they are no longer in the employ of those NPOs. That will be building the sustainable eradication of poverty as what I hear the members saying. I thank you, Chair.
Thank you very much, Minister. I'm now moving on to Honorable Kaiser.
No, thank you very much, Chair. Honorable Minister, considering the agency's strong bias towards the unemployed youth, particularly those with disabilities and women in rural areas, semi-rural and peri-urban, what percentage of the allocated budget and targets has your department aimed at ensuring support and development of the youth in terms of education skills development for entrance of entrepreneurs to become industrialists, and for which industries and manufacturing have these youths been developed? Thank you very much.
Honorable Minister.
Thank you very much, Honorable Chair. The honorable members, thank you very much for the question. I've already indicated on what the NDA is directly doing to an extent of what are the processes of development of young people as well as women and all the vulnerable. However, I can't give that standing here, Chair. I can provide your honorable office with that because that's a question that I did not see coming, because the Department of Social Development has many elements in that. It does have a section that deals with youth. It does have a section that deals with people with disability. And as such, it does have a section where it deals with everyone else who is involved or exposed in the gender-based violence and femicide. And that gives more than a female or a male. So I cannot give that stat standing here, Chair, but I can submit to honorable table staff that states to provide that detail to the honorable member and yourself. All the sections that I've just alluded to are hard at work in making sure that we change those lives of the younger people, the people with disability, as well as women, because that's our responsibility and our mandate according to the Constitution and the directive from the President of the Republic. I thank you, Chair.
Thank you very much, Honorable Minister. Would accordingly request that you furnish us with the supplementary stats within 10 days. We are now moving to the next question, which is asked by Honorable Brett from Freedom Front Plus. Over to you, Minister.
Thank you very much, Honorable Chair, and thank you, Honorable Brett, for the question. Honorable Chair and the member, our department is responsible for national bodies insofar as funding is concerned, which those national bodies are operating in more than 5 provinces. And in this regard, Honorable Chair, department does fund qualifying non-profit organization within the budget available under the transfers to NPOs. On approval, Honorable Chair, of their business plan, the department signs a service level agreement with those organizations. The number of funded national bodies that are approved, Chair, are 22. While these organizations are funded, the agreements stipulated conditions that organizations must meet in order to continue to be funded. The requirements is in line with the funding policies which make provision for remedial action where there are weaknesses. The signed agreement further outlines procedures to be followed to remedy any weaknesses or risks identified. And in this instance, the department did follow all the procedures to give the NPOs the opportunity to remedy the identified weaknesses where they exist, especially the NGOs that were funded. And in the past 5 years, Chair, we must make mention of the fact that we did do what is not being light of being defunding as according to the guidelines. We did embark on defunding between 2019 and 2024 and across various financial years. Our department defunded the non-profit organization as follows. One is Albinism Society of South Africa for the financial year of 2019 and 2020. The Khulisa Social Solution of for financial year of 2022 and 23. The Child Welfare South Africa for financial year of 2023 and 2024. However, Chair, the cases when NPOs were supported thus far to avoid defunding is when weaknesses is in finance-related aspects, such as weak finance policies and delegation of authority are identified. Then support and capacity is provided to strengthen their financial controls and capacity. It is provided to strengthen their financial controls. In other instances, Chair, the department provide capacity support to ensure that the NPOs report accurately in line with the funding requirements, because if that does not happen, then it triggers the defunding concept, which sometimes it becomes very difficult to take that decision, but it is needed for purposes of accounting. Chair, we must all note that prior that defunding, the organization are previously funded by the department. The main reason for defunding was due to them breaching terms of the signed service agreement. Part of the requirement in the signed service level agreement is for the organization to periodically report to the department. Remember, we are being funded by the department, therefore, by law, it's compulsory for you to report back. However, it has been established that provisions in the signed agreements are sometimes contravened due to the organization unsatisfactory performance and inaccurate reporting information. The aforementioned organization chair has then suffered the defunding. However, we must report that no one is taken to court, take us to court. We have not been taken to court for this, and therefore we did not incur any cost. Chair, in relation to measures to put in place to avoid similar situation, because it cannot be that defunding but not doing anything. As the department chair, we conduct due diligence to the recommended organization before they are funded to ascertain if they have the necessary governance, financial and internal control policies to render the required services and to safeguard these public funds allocated to them. During the contract and term, the department also monitors the utilization of funds and the implementation of agreed objectives and activities. In addition, an ongoing reminders are sent to the organization to facilitate compliance with reporting requirements. Where concerns are noted, these are communicated in writing to those organizations to allow them to remedy unsatisfactory performance and improve on compliance. Where potential risks are identified by the technical committee that provides oversight, and depending on the nature of the risk, support and guidance is provided to those NPOs where necessary, and development plans are developed and implemented to mitigate such risk. Honorable Chairperson, that's the response. I thank you.
Thank you very much, Honorable Minister. I'm now inviting Honorable Briet to make a follow-up question.
Thank you, House Chair, and thank you for that answer, Minister. That was quite in detail. I would just like to latch on and ask a question. How does the department ensure that when these terminations of funding happens, that it does not disrupt essential services provided by these NPOs to vulnerable communities? Is there a mechanism or a barrier which catches these communities to not be now left to their own account? Thank you.
Thank you very much, Honorable Briet. Honorable Minister.
Thank you very much, Honorable Chair. Thank you, Honorable Briet. Chair, because the legislative framework makes us to have a partnership between ourselves and those NPOs. I guess, Chair, that makes us to stick the relation between us and them, for them and us to make sure that they adhere to the agreements that are being signed. And Chair, whenever this abnormality is being identified, there's a committee that deals with that to deal with the situation where the defunding will take place. And in between, there's a technical committee that deals with those details, wherein we got to realize that that NPO sometimes is not reporting adequately, and that technical committee then deals with the matter. When that eventuality comes, as the honorable member is raising, we had to terminate, because if we don't do that, I guess this house will not be kind with us, because that will be a fruitless and wasteful expenditure. However, I think, Chair, we should now look at the spin-offs or the negativities that come out, as the honorable member is saying, because the actual people who get the service will now not get that because of what is not out of their own making, which I understand very well. Therefore, now we should a little bit grow and further develop now that element that then ask a question from that process of having forced to defund. What do you then do with the people who have been on the receiving side insofar as the service is concerned? Understanding the role that is being played by our NPOs in make sure that they assist government and our people to change their lives where they are. I take it as an advice, Chair, that let's now go and look at the eventuality where we have to defund what then becomes the implication that are negative to the actual people who are receiving that service. We can provide that, Chair, but we can take that as an advice to make sure that we complete now this cycle to say, having forced to defund, what do we then do with the actual beneficiaries of the services? We never looked at that. I guess we must now go and look at that because the reason of existence of the NPOs and the funding, therefore, is to make sure that our people's life are being bettered by those in NPOs in particular. That will be my response in the question. I thank you, Honorable Chair.
Thank you very much, Honorable Minister. I'm now inviting Honorable Makesini to ask the Minister the question.
Thank you.
The
Chair.
follow-up question, sorry.
Thank you, Chairperson. What steps did the Minister take to engage with the defunded NPO? Were any alternative funding arrangement or remedial action to offer to affected NPO prior their defunding? How does the department plan to improve the communication with the NPOs in future for the funding arrangement to avoid the misunderstanding and disputes? Thank you, Chair.
Honorable Minister.
Thank you very much, Honorable Member. Thank you, Honorable Member, for the question. Honorable Chair, I want to emphasize that we get into partnership with the NPOs. We sign service level agreement, which all that entails, which then says whenever there is this misdemeanor of not reporting, there are processes that we must follow as a department. Therefore, there's a technical committee that follows up on the constant reporting, identifying risk, and therefore mitigate those risks when we have identified them. It's only when everything has been said and done, then we'll have to defund. We are constantly, because of the fact that what we give or assign to NPOs is part of our budget, which on an annual basis we must account for. So we can't afford not to know what is going on in that regard. Otherwise, the AG will come very hard on us. Therefore, there is no time where we don't know what they are doing for the fact that we must follow the money. And then it is when we are unable to do anything to change the situation where we defund. But constantly, Chair, we are with them all the time. Remember, Chair, there are a majority of NPOs which are very genuine in assisting and make sure that they provide services to our people. However, there are those bogus ones, Chair, which we are sometimes forced to defund because they are never in from initial stages where people would or groupings would want to make sure that they change people's lives where they are. And this is where we become harsh and defund. Other than that, Chair, we are all the time in working together with those NPOs, not because they are assisting government in making sure that they provide services, but we also follow the money that has been given to them for the purpose of accounting, as well as making sure that what they meant to do, they are doing, but what that money was allocated for is being honored. I thank you, Honorable Chair.
Thank you very much, Honorable Minister. I'm now inviting Honorable Feni to ask the Minister the follow-up question.
Thank you, Honorable Chairperson. Let me greet umphathiswa wezenhlalakahle wesebe lezenhlalakahle. Mphathiswa, umbuzo wam uthi kule meko ngokwale meko sijongene nayo yemeko kule meko yezoqoqosho ingentlanga. Iyenza loo nto leyo kunciphe nesabelo esezimali kwisebe. Nale ngxaki yendlela yokuphila imbi kakhulu kubantu bakuthi. Ingaba isebe linalona iqhinga nesicwangciso elinaso sokuqinisekisa into yokuba ngabana imibutho le ingajonganga nzuzo iyakwazi na ukuqhubekeka incedisa abo bangathathi ntweni kakhulu ngokubanceda, ngokubanikezela ngeenkonzo ingakumbi kwicala lezomthetho lokuncedisana nabo kwicala lezomthetho. Bendifuna uqonda ke loo nto leyo ke mphathiswa wam obekekileyo. Enkosi.
Siyabulela, Tatufeni. Minister, you may respond.
Thank you, Honorable Chair, and thank you to the Honorable Member who have asked the question. Kwinyani ecacileyo nengenako uphikiswa nangubani uba uqoqosho lwelizwe lonke neloMzantsi Afrika libandakanyeka alikho lihle ngokuba aluvezi imisebenzi, alugayi imisebenzi, yenze loo nto abantu bafumanise bengakwazi ukufumana imisebenzi. Loo nto ke mhlawumbi ngaphambili wale ndlu ibakekileyo yenze uba i-department isebe eli lezenhlalakahle ligqugquzele ukuhlanganisa nokuba ne-partnership nabantu okanye imibutho ekwaziyo ukuba enemali zawo nekwaziyo ukuba ingancedisa ngokusemthethweni ukwenza ukuba ii-NPOs existe ziwenze umsebenzi wazo. Loo nto siyenza through a private partnership wherein we are in partnership with those organizations that have interest in making sure that they contribute in the existence of the NPO so that they can be able to deliver the service to our people. Chair, we know in South Africa from the early days of apartheid, there has been always progressive NGOs that has always contributed in this regard. There are still those which are quite progressive and very consistent in doing this. Some of them, Chair, are training our people as trainers, paralegals, and so on, for them to understand the Constitution of the Republic so that they can be able to articulate and be able to understand their rights as individuals and as abahlali baseMzantsi Afrika. Abanye bakhona phaya ekugcinweni kwabantwana, the early childhood development centers, where we find our people there with the sustainable programs, with partnerships that are coming from private people who are consistently funding them. And then these, Chair, our own initiatives in realization of the fact that our budget can't afford to stretch that far to get to really make sure that we consistently keep that our people and their NPOs are able to assist. And remember, Chair, for that reason, NPO are people's NPOs. Therefore, it's about people changing their lives, but of course, working with government. Therefore, we take this responsibility very serious, Chair, because this is in line with what as this government would want to see, wherein people don't necessarily rely on government only or government grants and so on, but our people are able from their own initiatives to create their own jobs, whilst at the same time they are changing the lives of our people, themselves, and the society as at large. We are, Chair, very busy in that regard to make sure that those partners are working closely with us to make sure that we sustain what we find, what is there. We also grow what we'd want to see, especially, Chair, the 7th administration priorities, which the DST is in the center of those, and in the main, the eradication of poverty. I thank you, Chair.
Thank you, Honorable Minister. The last speaker on this question to ask the
and explain the defunding as well as the measures put in place to these many thousands of now vulnerable South Africans.
You may respond, Honourable Minister.
Chair, thank you very much. Chair, I won't lie in this house and I say I did personally visit. I haven't been able to. However, I know for a fact, especially in Gauteng, that there is that kind of a situation, and the department itself is interacting very close with Gauteng because it's Gauteng who is severe of that kind of an experience. We are working closely with Gauteng since this emerges, and to an extent, we can safely respond to say they are almost there, Chair, to make sure that those NPOs who were budgeted for to be funded are in fact funded as according to their financial priorities. It has not been a very easy process because members would understand that there's a court case that is pending. However, due to our IGR processes, we have been able to nudge and work with Gauteng to make sure that they achieve this in understanding the importance of those NPOs. Other than that, Chair, I can safely say the department is aware of that, and department is working with Gauteng provinces and other provinces. Hence, I can reliably report to say even Gauteng, which we see as the West, is coming up okay in making sure that those that were defunded wrongly are being funded back, but those who were defunded because of all this that I've alluded on earlier, it's going to take time for them to be funded until they put a turnaround strategy to make sure and assure us that when we put money, it will be accounted for as according to the legislative framework that exists in that regard. Thank you very much, Chair.
Thank you very much, Honourable Minister. We are now moving on to question number 134, which is asked by Honourable Aris, EFF Northwest, to the Minister. Over to you, Minister.
Honorable Chair, I hear members said I must sweep Gauteng. I don't have that responsibility, Chair. Gauteng will take me to court. They have a right, Chair. We are a three-sphere government. They are a government themselves. We are government. We are a three-sphere government. Therefore, it's only in the IGR processes where we can work together, but I'm not bigger than them. They've got their own budget. They've got their own priorities. We can just work together in nudging each other to do the right thing, especially when it comes to our grant funding. Thank you very much. Honorable members, let me firstly stress the National Department of Social Development and Provincial Development in South Africa. We have different roles to meet the demands of development social services. The Constitution divides functions among three-sphere government and clearly distinguishes between exclusive and concurrent responsibilities. And in this case, Chair, the social development is a concurrent function. Therefore, to provide support to provincial counterparts, the department is continuously, Chair, assisting and talking closely to its provinces to make sure that we monitor the implementation of funding of our NPOs to ensure that especially transfers to them is in line with the time frame stated in the contract with those NPO, as I said earlier on. Chair, the department does acknowledge that partnership with NPO is critical for the delivery of development social services, as I said earlier on. And our department also acknowledged that it is important to strengthen and maintain that partnership with NPO sector and ensure that all available capacities optimally utilized in support of those NPOs. We are delighted that significant progress has been made ensuring support to those, especially in Gauteng. Chair, yes, we must report that the department in this regard, you are also employing procedures to ensure that funding policy implementation is effective. One of such key measures is by requesting provinces to provide reports to us on the disbursing of those funds on a quarterly basis. We are trying, Chair, and nudging everybody to do the right thing, but no one in the Constitution of the Republic is carrying a stick to whip anybody, because you can be taken to court for anything and for everything, especially the members next to me. He knows that very well. So you must see to it that you understand the Constitution of the Republic and act within it, not being emotional sometimes. I thank you, Chair.
Thank you very much, Honorable Minister. Order, honorable members. We are now moving on to the next follow-up question, which is asked by Honorable Baines from ANC.
Honorable Aris, Chairperson.
Oh, sorry, my sincere apologies. I just jumped to Honorable Baines instead of taking first the originator of the question. Honorable Aris, you are now
Yeah.
going to platform.
Thank you very much, Chairperson.
Apology.
Chairperson.
Point of
Yes.
order, Chair.
Chairperson, thank you very much.
Honorable Aris, can you hold on? There's a point of order. You are raising
Yes.
on which rule, Honorable Farmer?
Thank you, Chair. I rise on Rule 59(1). A delegate may speak in a debate in the council only when called upon to do so by the officer presiding. Chairperson, for how long are you going to allow Honorable Barnos to just speak without being recognized?
Welcome back to the house.
And he does it again.
Hy het skool toe gaan, man.
Honorable members, the point of order is sustained. Members are allowed to converse in the house, but not allowed, and not to drown other speakers and speak whilst other speakers are speaking. So kuthethwa apha. Now we can't help you if you are a member who does not have that sense of responsibility to uphold the decorum of the house. We are not saying that members should not converse, but not so loud to a point that it irritates. We don't want to stifle the freedom of expression within the house. That is also equally enshrined within the Constitution. So there has to be balance in that regard. Therefore, we are adults before we are honorable members. And the public is expecting much of us. And therefore, you know, sometimes you learn, honorable members, not to be deep focused. Try very hard not to be unnecessarily defocused, because two wrong can never make a right. It's a matter of principle. Thank you very much, Honorable Aris. Sorry for taking your time. You may take the podium.
Yeah, thank you very much, Chairperson. Thank you very much, Minister, for your response. However, I'm disappointed because I don't hear anything that you have said in terms of consequence management for these departments, because people need to be held accountable. It can't be that people underspend the budget and nothing has happened to them. So yes, and it remains your responsibility, whether it's the Department of Gauteng or any other province. It is upon you to ensure that consequence management being put in place. However, the department aimed to sponsor 1,308 people to complete inpatient drug rehabilitation treatment in the first quarter of the department's financial year, April to June 2024. But only 149 had done so by the end of the quarter, because two large drug rehabilitation centers in Randfontein and in Witpoort, managed by Kanhisa, have shut down their doors after the funding was withdrawn by the Gauteng Department of Social Development. Minister, as the country grapple with substance abuse, how will you ensure that all public rehabilitation centers get funded in order to curb this pandemic the country is faced? Thank you.
Honorable Minister.
Thank you very much, Honorable Chair. Honorable Chair, like I said earlier on, Gauteng is part of 9 provinces in South Africa, like Western Cape, Eastern Cape, and so on. They have their mandate as according to the dispersion of the budget by Treasury. They spend it according to their plan, and as such, therefore, all the existing bodies to play oversight. This house included. This house included because this house chair is one house, unlike all other houses, that has a role to play in making sure that provinces are being made and nudged to do the right thing, especially when it comes to spending, especially to the vulnerable people. So I want to say, Chair, and suggest that this house has more powers than we have to play oversight in provinces in particular. And as such, I would expect this august house chair to really engage into that, because this, as I've said earlier on, is a problem and headache to all of us, because we understand and accept the role that is being played by the NPOs. And for any time, doesn't matter how long, that the NPOs are not funded, we know what the implications are. We, Chair, are playing what is expected of us to do. And I then said, we are now, especially on grant funding, we have developed a process wherein we make sure that we do the assessment on quarterly basis on how far have they've gone in the grants that we have disbursed to them insofar as funding is concerned. Yes, Chair. When you talk about NPOs, what the Honorable Member is saying, the issue of abuse of drugs is part of those very NPOs, very important NPOs that are playing that role in making sure that they deal decisively with that socially ill, which when they are not funded, indeed, that becomes a problem for all of us. Hence, Chair, I am then saying, we are now having engaged with Gauteng with the latest report that this house is aware of. Gauteng is almost there in making sure that the right thing is being done to disperse that money as according to the initial plan to the rightful people. And in going forward, will effect the issue of monitoring to make sure that they do as such. However, this house should also play its role, Chair. Someone, Gauteng province, before you, for them to come and account on all the issues that you think you are not happy with. We will play our role. In fact, we are already playing our role. Hence, today we have never been loud about this since its inception, but now we can proudly report that they are almost there, because we thought it's important for us to get closer, not being loud, and work with them to make sure that the right thing has happened. I thank you, Honorable Chair.
Thank you very much, Honorable Minister. I'm now moving on to Honorable Baines from ANC. Honorable Baines. Yes, she is. Over to you, Honorable Baines. Can you unmute her? Can you unmute her, please?
Good morning, Chairperson. Can you hear me?
Yes, you can proceed, Honorable Baines. Thanks.
Okay. I would like to apologize. There was something that I didn't understand now, but good morning to you. Good morning to the Minister, and good morning to all honorable members. Minister, I would love to applaud you for the way that you are responding to the questions. I think I'm partly covered, but there's one part that I would love to know from your department is how is your department providing capacity support to the NPOs in order to meet the funding criteria and legal obligations? Thank you.
Thank you very much, Honorable Baines. Honorable Minister.
Thank you, Honorable Chair. Thank you to Honorable Bain for the question. Honorable Chair, we receive a lot of applications for NPOs to be funded by ourselves. given the fact that, as I've already alluded to, the fact that our country and the society is going through social ills, which then demands that there should be NPOs that are progressive to deal with such in partnership with government. And there's a strategy and criteria to identify those that are capable according to our framework that we have put in place. However, even if we can get more of those, remember, the resources are quite limited. We would love to fund everybody, but we are unable to. To those that we eventually fund, we are happy, Chair, to report that there's a very extensive framework that makes us to be able, having been identified to be funded, to make sure that they account accordingly, as according to the timelines that are put in place and the service level agreement that has been signed between us and them. Hence, eventually, Chair, you had not so good news of defunding and sometimes deregister, because we do this, Chair, in line with our service level agreement. Before that, Chair, we get to a very extensive process of making sure that we train them. Once they are being identified, we take them through extensive training of some basic elements of an NPO, but they graduate to make sure that where they are in a situation where they can be taken through the institution of higher learning, we do that. We do that, Chair, in line with the legislative framework, so that, Chair, they don't just remain as NPOs. They will be able at some point, assisted by us, to themselves put meaningful businesses, create jobs for other people, and take themselves out of the poverty and make sure that they contribute into the bigger economy of our country. So, Chair, that process is in place, and is quite impressive to see that some NPOs do emerge in those processes, Chair. Of course, it is difficult, but they do emerge to be sustainable NPOs that are consistently funded by our department and other partners that we are working with in that regard. Thank you so much, Chair, for the question.
Thank you very much, Honorable Minister. We're now moving to Honorable Badenhorst from DA.
Minister, it's not our job to do your job. You get paid to do your job. We don't get paid to do your job. The life is a many tragedy visited on
Point of order,
vulnerable
Chair.
in Gauteng by the provincial health
Honorable
department.
Badenhorst, can you please take your seat? Honorable Badenhorst, please take your seat. Honorable Fadet, you're raising on rule, which
Chairperson,
rule?
I rise on rule 58. A delegate must address the chair when speaking and not the minister. Good chair.
Your order is sustained, Honorable Farmer. Over to you, Honorable Badenhorst. Please don't address the minister, address the chair.
Honorable Chair, it's not this minister's job to come and tell us how to do our job. She must do her job. The life is the many tragedy visited upon the vulnerable in Gauteng, Minister, by the provincial health department still brings shame on all of us in government. The scandal in the social development department is the next life is the many. And make no mistake, Minister, through you to the chair, this is a scandal. There was an outcry in the media by NGOs championed by the MPL Refilwe and Cheke when the funding dried up without warning. Why was the provincial government not more closely monitored so that there could be at least an early intervention? Why was the money that was available to our elderly, our abandoned children, and our disabled not spent? Does your ministry and you, Minister, care so little? Shame on your ministry and shame on you, Minister.
Honorable Minister, as this House, we really and truly appreciate when the executive has that sense and demonstrate that they understand the mandate of the NCOP. It gives us courage, and it gives us a sense of indication and appreciation that when the NCOP speaks on behalf of the provinces, the ministers will understand and enable whatever that is brought by this house. We appreciate you on that aspect. You're not the first minister who then displayed a full understanding of the work of the NCOP. Honorable Machodini was once here again last week. She did precisely that. On the contrary, the very same member who's taking a beef on you highly commended Honorable Machodini for that, which is wish. So don't be moved by flies. Focus, don't lose your eyes on the ball. You are doing well, Minister, in terms of accounting to the members of the House.
Thank you very much, Honorable Chairperson, to honorable members. I commit, Chair, I will not allow myself to be defocused. I'll remain factual on the issues that I'm raising. And indeed, Chair, it is a shame to the nation to want to experience at Etisidimeni. No normal person can smile into that experience. So the honorable member must rest assured that we are members and people of this country. And when that abnormality happened, it all gave us a little bit sad. We all sad. And we hope that it will not repeat itself. And this is why, Chair, earlier on I then said, alluded to the fact that we are working closely with Gauteng province to make sure that things are changed for the better. And this is why, Chair, today we are reporting proudly so that they've turned the corner. They're almost there in making sure that rightful NPOs are being paid. Chair, we did that because of the realization of the consent of this house that that was not happening in time and according to the legal framework that exists between Gauteng province and those NPOs. And that's the reason why the National Department of Social Development had to come closer to Department of Social Development in Gauteng and work with them to make sure that that eventuality is in fact realized. This is what we do, Chair, as according to existing laws that makes us to be able to work with our sister departments as well with our provinces and districts. Yes, Chair, it might not be perfect because these are 3 spheres of government. There's no junior partner here. We are all equal before the Constitution. It is only when we've evoked Section 100 in a province where we'll be able to preside over that province. But for now, Chair, they must be allowed to lead and do what is enshrined in the Constitution for that provincial government. However, Chair, we've emphasized that we are in that space in making sure that we change things around, and we re-emphasize that we've done that, Chair, and we are all concerned, Chair, that this has happened. But you just to sit and be concerned is not really give you answers. What we've done is to make sure that we change things around, which today, Chair, I stand before you in this august house to say things have drastically changed with the intervention that we have introduced in Gauteng, and we are closely in making sure that those NPOs are being paid. And yes, not in time, Chair, we must register that consent. Hence, if everything was hunky-dory, there was no reason for us to be in that space. But for the fact that there were difficulties, we had to come closer. We can't be loud, honorable members, when we come closer to make sure that the right things happen, because it's not about us, it's about the people who are supposed to receive the services of both government and NPOs. Hence, Chair, it's not a proud thing that we can come and boast about here. It's something that we must quietly resolve and assure our people that is not going to happen again. I thank you, Honorable Chair.
Thank you very much, Honorable Minister, for your profound articulation in line with Chapter 6 of the Constitution of the Republic of South Africa. I'm now inviting Honorable Majola to take to ask the Minister the response.
Thank you, Honorable Chair. Honorable Minister, thank you very much for your responses. in particular to learn that you do have the performance-based assessment from the provinces on a quarterly basis. Having said that, Honorable Minister, the Auditor General in the recent financial years raised the issues of the unspent funds earmarked for the NGOs, citing the different reasons in the different financial years. Just to zoom the two financial year, the 2021-2022 financial year, the Auditor General raised the issue of the administrative inefficiencies and delay in dispensing of the NGO funds. Again, in 2022-2023, the similar issues were raised by the Auditor General. My question to the Honorable Minister is that, having listened to you with the performance-based processes you are implementing in your department, still Auditor General is not 100% happy. And you also did mention that there are still some instances where the unspent or the delay in terms of distributing the funds to the NGO are still happening. Do you think, Honorable Minister, the performance-based in place will avoid the future occurrence in terms of the Auditor General's outcomes? Thank you.
Majola, Honorable Minister.
Thank you very much, Honorable Chair, and thank you, Honorable Majola, for the question. Chair, I guess we must be big enough to say some of the things that are going to happen are not so good, and we see them coming. In this case of Gauteng and dispersion of the money to the NPOs, indeed, it's going to reflect in the 2024-25 AG's report, for obvious reasons that all of the members in the House have articulated on the concern of delays, of the fact that the money or what is entitled to NPOs of Gauteng has not been processed in time. And therefore, it delayed the implementation of those NPO programs. And as such, the implementation, the implications will such that, again, the AG will fund accordingly for the third or fourth time. I must accept that, Chair. That is going to be the case for the fact that it is only now released, now that we have intervened, everybody has been loud to say how didn't do the right thing. I must accept here, Chair, that that's going to be the situation. And hence we should take it upon ourselves to get closer to how did, as we have done, and raise this concern that when the AG is found against you, it becomes a problem because now AG's powers are more or bigger and more effective than once were. At some point, there will be consequences to individuals. Maybe we should be loud about this to our provinces to say you are risking of being penalized and having to be individual responsible for this. In the nutshell, Honorable Majola, I say and accept and I agree with you that this time around, this normality is going to happen because we're almost now at the third quarter of the financial year. And only now that the process of dispersing of those grants is taking place, which therefore means that those NPOs will underspend, not because of their own making, but because of the late dispersion of their grants by the provincial government. I want to commit to this House, Chair, once again to say, we are closely looking into this abnormality for us to be able to turn it around, because that AG's outcome does not reflect to individuals, it reflects to all of us, and it suggests that we are not doing what we are paid for, Honorable Member, and all of us, because some are expected to implement, some are expected to play oversight, and all of us will be found by AG to not have able to do the right thing. And as part of the executive, I am taking that a kind of a problem to say. We are working very close with Gauteng to make sure that we will change the matters. However, we can't change now what is going to be the outcome of 23-24. Yes, 23-24. That might indirectly influence 24-25 because it will get there because it's almost now less than 7 months for us to get into the new financial year. We'll hear from them what they want to do within the legislative framework with those funds that will be not spent because of these difficulties. So, Honorable Majola, I accept what you are saying as a fact, and I commit to say we'll do everything in our power to make sure that we change things around, but we will not change what has happened already, but we can mitigate that it doesn't happen in the future. Thank you very much, Honorable Member.
Thank you very much, Honorable Minister. We're now stepping off this question. We are taking the last question with you, Honorable Minister, which is question number 131, asked by Honorable Fanny from ANC. Over to you, Minister.
And thank you very much, Honorable Chairperson of the House, and thank you, Honorable Fanny, for the question. Honorable Chair, Kuseleka one-stop centers, which provide life-saving services to survivors of gender-based violence, such as psychosocial support and trauma counseling, are available in 4 out of 9 provinces in South Africa. And those provinces are Eastern Cape, Limpopo, Northwest, and Western Cape. Chair, the criteria that was used to provide this is the establishment of this center is identified domestic and sexual violence, prevalence of domestic and sexual violence in those provinces and in the country. Chair, those areas where we don't have those shelters, we are hard at work in working with the Department of Public Works, wherein they've indicated, as I alluded to earlier on, that they would disperse some buildings wherein we can use to make sure that we extend this to other provinces. Chair, the reasons of the non-availability of some in other provinces is also attributed in the limitation of resources and the readiness of those buildings. Remember, it's upon the Department of Public Works where they can be ready and allocate those facilities for us to access. Chair, as Department of Social Development, we are planning to establish in provinces shelters as we are doing in some. And currently, Chair, we are in partnership with that Department of Home Affairs, and as such, Chair, we have identified those provinces that don't have those centers. Chair, we have made mention of the fact that the Department of Public Works has also indicated that there will be a budget. They also are busy with rezoning of those areas. Remember, they were utilized for different reasons, and now we want them to be used for these centers. Furthermore, Chair, also devising means to realize this initiative through seeking financial support from prospective donors and development partners. Chair, government alone can't be able to do all this, but we are very hard at work in making sure that our partnership with other sectors, our sister departments, and our relevant donors can make us to achieve this. Chair, the response and innovation model, it is meant to address challenge of offering a continuum of services to victims of crime and violence. These centers are in the community-based facilities. They are offering services to victims of crime and violence through a multidisciplinary approach comprising of teams of social workers, nurses, doctors, police officials, court preparation officers, and prosecutors from one central point under one roof from different stakeholders. This secondary victimization, Chair, because it can happen in this regard, it is avoided when each role player contributes their part in servicing an individual victim of crime. And anecdotal evidence is evidence in these comrades, wherein 25 victims are utilizing our centers on a quarterly basis. This is how I respond to the question. I thank you, Chair.
Thank you very much, Honorable Minister. I'm now taking Honorable Peter.
Thank you, Chair.
Sorry. I'm taking Honorable Fanny, who asked the initial question. Sorry, my apology. Just a second.
Thank you, Chair. It's Honorable Finis. Thank you, Honorable Minister, for the exhaustive response to my question. Honorable Minister, what measures are in place to provide services to victims of violence and crime in provinces?
Honorable Finis, can you hold on a moment? There's a point of order. Honorable.
Thank you, Honorable Chair, and good morning. Chair, I rise on Rule 58, read with Rule 69, sub-Rule 12. The Honorable Chair made the final ruling that delegates may not address the Minister directly and must address the Honorable Chair. The previous speaker, you've allowed to address the Honorable Minister directly, and you've already also allowed this Honorable Member to address the Minister directly. So I rise on the Rule 58. A delegate must address the Chair when speaking, and if possible, must stand while doing so. So I think we should have consistency, Honorable Chair. Thank you.
Definitely, Honourable Member, the order is sustained. As we have indicated, Honourable Members, please speak through the chairperson whilst addressing the Minister. But as you speak, there's nothing that stops you from saying, Honourable Minister, this and that. But please, let's address the House through the Speaker. Thank you.
Point order, Chair.
Yes, Honorable Badenhorst. And I must, maybe before I allow you, I must explain and contextualize what I'm saying. Now, a member stands up and you go peacefully addressing the Minister, not through it depends how you do it. It's a question of the lingo and how you do it that bothers on a particular situation. Let's just bear that in mind as well. Rules can't be explicit in everything, but some of the things are really provocative and uncalled for, Honourable Members. Honourable Badenhorst?
Thank
Yes.
you. Thank you very much, Honourable Chair. I rise on Rule 58.
Yes, Honourable Badenhorst, you may proceed.
Thank you, Honourable Chair. Honourable Chair, could we get a legal opinion whether Rule 58, which is part of Part 2, the rules of debate, is also applicable to Part 2, questions for oral reply? Because the way I read this Rule 58 is that's for debating. We are not debating, we are asking oral questions. So should we apply the same rules of debate to asking oral questions? Thank you, Honourable Chair.
Honourable Badenhorst will certainly ask for a legal opinion, but definitely some of these things, they are way too obvious. The rule of the House is every speaker in the podium must address every member must address the speaker on the podium through the chairperson who is sharing at the time. So irregardless of whether we're debating, whether we are for oral reply, or whether we are amongst ourselves tabling various reports. But nonetheless, we may take that certainly for a legal opinion. But the speakers must address the speaker on the podium through the chairperson.
Chair?
Over to
Sorry,
Yes, Honorable.
Chair, then just, can we please refer you to Rule 2261?
Yes, you may proceed.
Questions for oral reply to members of cabinet. It doesn't say questions for oral reply to members of cabinet through the chair. Thank you, Chair.
No, we're playing semantics here now, Honorable Badenhorst. We're playing semantics and we're not going to entertain those semantics. Certain things are just obvious and therefore we're not going to allow this thing. Please, let's focus on the business of the day. I've ruled on this matter. Let's allow Honorable Finney to address us through the follow-up question to the Minister. Over to you, Honorable Finis, and my apology for pronouncing your surname wrongly. Honorable Badenhorst, I'm asking you for the last time, please respect the House. Honorable Finis.
Thank you, Honorable Chair. Through you, Honorable Chair, I want to thank the Honorable Minister for the exhaustive response to my question. Through the Chair, Honorable Minister, what measures are in place to provide services to victims of violence and crime in provinces where there are no Kusaleke one-stop centers? I thank you, Chair.
Thank you very much, Honorable Finis. Honorable Minister.
Thank you, Honorable Chairperson. Indeed, there are provinces that don't have these shelters, as I have indicated. However, we are hard at work in making sure that we put shelters in provinces where they don't have this. And this is informed by the fact that there's a process of establishing centers in all provinces. But because of limited resources, we are in other provinces where we have not yet established those. We are busy establishing shelters, and we are doing that in partnership with all other sister departments and the NPOs that are in existence who have experience in this regard. The only thing that we are doing sharply is training so that inside those centers, the right thing is happening. Other than that, Chair, we assume and we are praying very hard that by the end of 2030, we must have been able to have centers in all 9 provinces. Of course, that is informed by the reliable research from State South Africa that reports on the numbers of areas that are bedeviled by poverty, but also informed by the level of gender-based violence and femicide in all those provinces. So we are following that, Chair, on which province and when. And the system that we are using is the prevalence of gender-based violence and femicide, as well as the systems that seeks to eradicate poverty. Because in really dealing with that, Chair, you must be able to deal with these members sometimes who are victims, but have a process wherein you totally liberate them from not only from the gender-based violence and femicide, but also for them to be able to sustain themselves so that if they are having partners that are abusive, they don't stay in those partnerships for the fact that those abusive partners are breadwinners, but they can walk away. But the government and working with NPOs and other partners are able to provide that kind of assistance. So this is what we are doing, Chair. We are going to realize it because the steps that we have taken since the promulgation of this from the bill to the law, we can recognize and assure the House that we have made good steps. I thank you, Honorable Member.
Thank you, Honorable Minister. We are now moving on to Honorable Peter from UDM.
Thank you, Chair. Greetings, Minister. In light of the department's decision to cut funding for non-profit organizations that provide critical support to vulnerable communities, including centers for gender-based violence, these NPOs have been significantly crippled as they relied on the department's funding to operate and provide services. My question is, Minister, how many GBV centers have been affected by these significant budget cuts? Number two, what is the department's plan to find an effective solution for funding to ensure that the GBV centers continues to operate and provide the necessary support to those who need it most? Thank you, Minister.
Thank you very much, Honorable Peter. Honorable Minister.
Thank you very much, Honorable Chairperson and honorable members for the question. Chair, I want to assure the House that the department does not just terminate funding just willy-nilly. First and foremost, we have recognized the fact that the fiscus is shrinking, which that is beyond our control. So what is then there for us through Treasury and all other known and accepted processes where we get our share? We have a responsibility, as according to the law that exists in South Africa, to make sure that we account on each and every cent that we receive. And in this case, because of the mandate as DST, we are working closely and in partnership with NPOs, wherein, as honorable members have just alluded to, we have to disperse funds to those NPO for them to exist and be able to do what they do best and what is expected of them. However, Chair, there should be, as according to the agreements that we've signed between ourselves and those NPOs, the accountability systems must adhere to all the time. And in that, Chair, there is no excuse. However, as I said earlier on, we don't simply get there where we either defund or deregister. There's a process that takes us into that regard. Chair, we know for a fact that the intention of these NPOs is a good one, but in line with that, if they receive funds from us, it's compulsory for them to account to the last cent. Because if that doesn't happen, Chair, you would know this House will frown at us because that will be a fruitless and wasteful expenditure. Therefore, I want to assure the House here and you, honorable member, that we don't necessarily just terminate or defund or deregister. There'll always be reasons. But in between that, us having identified the problem and at the end having to defund or deregister, there's a process that we follow where there's a technical committee that assists those NPOs to make sure that they exist according to the document that they presented for the department to allow them or recommend them to be funded. So this is a process that starts from the day of applying for them to be recognized and be funded until they are able to give the services that they committed to do. And where, unfortunately, we had to defund or deregister, it's a very not so good situation, but it's a situation where we must get into when we've done everything according to the book to make sure that we sustain those NPOs. Because yes, Chair, we know and accept the fact that those NPOs are doing what sometimes government can't do because one, they are within those communities. Two, they are communities themselves. Therefore, it's easier to walk a girl child can be able to go to Mamtolashe in that center because she has she's more comfortable to talk to me than an official who have got a tie coming from DST. So then it becomes important for those NPOs for us to make sure that they are sustainable, but that should not be at the expense of the accounting processes. And when we had to defund or Chair to deregister, we had to, but we would have followed a process. But like the member earlier on asked, what do you then do with those members of these communities who were benefiting out of that NPO, and that situation of them being defunded is not necessarily their problem? I then committed to say that is now the question that we must look at, to say now that they've failed all the tests, what do we then do with people who were receiving that service? Because it's not because of their own making, it's because of the NPO that really in fact, failed them and us. But as government, we have a responsibility to look after those, which I then commit to say that's the area that we must look at for us to complete the cycle. And when we come back to this house, we'll then say we have completed the cycle to an extent. We now know what do we do with those communities that are left without that kind of a service, not because of their own making, but they have a right, and the Constitution dictates that they must get that service either through NPOs or through government when this agreement. Thank you so much, Honorable Chair.
Thank you very much, Honorable Minister. We're now moving on to the next speaker, who is Honorable Siwisa.
Thank you, Chair. Thank you, Chairperson, and thank you for affording me the opportunity to ask a question. Through you, Chair, Minister, it's very disappointing that 31 years into democracy and 6 years before we realized the Vision 2030, we are still speaking about only out of 4 provinces, out of 9 provinces, only 4 provinces do have one-stop centers. And the reasons are that they are limited is because of limitation to resources. It's very disappointing because GBV is on the rise. Some of these women are still stuck to be staying with their abusive partners or husbands or mothers or fathers. Minister, each town needs to have a one-stop center for victims. If these centers will be built, they will mostly be concentrated in urban areas of hotspots, and the smaller areas, especially rural areas, will be most neglected in the process, and this will be due to low number of reports on any GBV that happens. Low number of reports is due to lack of resources in those small towns and traditionalism in some of these areas. What measures have been put in place to ensure that victims in non-hotspot areas and rural areas are afforded the same services without having to travel long distances, like the victims in the Northern Cape that have to move from Northern Cape to Free State if they need to have a one-stop victim center? Thank you, Chair.
I take it you are done, Honorable Siwisa, and I didn't hear any question that has been asked, Minister. I don't know if you want to reflect from what has been said by Honorable Siwisa. Over to you.
Thank you, Honorable Chairperson. Thank you, Comrade Sweeter. This is quite a pertinent debate, Chair, of gender-based violence and femicide. You can't ignore it at any given time. Whatever question that is asked, you really want to respond because you want to assure South Africans that for the first time, we have a law that directly deals with gender-based violence and femicide, which for all these years we did not have. We have been, all of us, talking in between ourselves in different ways as individual departments. Now there's a concerted effort to say there's now a law that everybody must abide to, and there's a department that has been given this responsibility, which is in this case is the Department of Social Development. Therefore, any question must be responded to. So I want to assure that to honorable members, yes, what she's saying has been the situation, hence the law that was promulgated on the eve of the 29th, because of all the issues that the honorable member is raising. And yes, Chair, out of 9 provinces, I've alluded to the fact that only 4 that we have been able to put these centers. And also, Chair, I articulated the reason why 4. I spoke about the prevalence as well as availability of gender-based violence and femicide. And this is the most reliable area that you can. When anybody asks you what makes you to be having a center in Gauteng, either than in Mpumalanga, the reason will always be the prevalence is forcing us. But that, Honorable Chair, does not necessarily mean that there is no gender-based violence and femicide in Mpumalanga, KZN, and Eastern Cape. There is. Yes, Chair, we all agree that in some areas, this scourge is not being reported accordingly because of the historical things that sometimes when it happens around the family, it becomes a family matter. And indeed, the honorable member is correct to say, even when she wants to report it, the police station is far away from her, the center does not exist anywhere, which is why, Chair, as this department, we are very committed. We have even put timeframes on when will be concluded to make sure that these centers do exist. But alternatively, Chair, we have put shelters that seeks to address this scourge in areas where there are no centers. We are working with all other departments to make sure that this has happened. And Chair, we commit that the timelines that we are putting here, presenting before you, will be achieved. And this House will be there to make sure that we do that. I accept the question, Chair, to be more educative, to say everything must be done. Every resource must be released for us to be able to deal decisively with the gender-based violence and femicide because it affects the majority and the most vulnerable of this country. Women are in the majority of this country. Therefore, there can be no coherent nation if the majority of that nation, especially women, are victims of gender-based violence, and especially when it's not only women, it's women with their children. We take that, Chair, very seriously. We are making sure that we address all those. But, Chair, with the availability of resources, we'll hamba kahle, but with the inclusion of all other stakeholders when it comes to resource available, we will work with them towards the realization and addressing of the scourge. I thank you, Honorable Chair.
Thank you very much, Honorable Minister. We have come to the end of the questions to your good self. Am I? Who's that? Oh, oh my God. I don't know what I'm doing to you. I'm so sorry, you think I'm picking up on you today. I'm so sorry for that. Honorable Andrianse, this is your time.
Thank you, Honourable Chairperson, Honourable Minister. As the Department of Social Development engage with the Department of Health to support the medical needs that the centres of this nature require, especially in the areas where there's none at the moment. Thank you.
Very much, Honourable Minister.
Thank you very much, Honourable Chairperson, and thank you to the honourable members. Honourable Chair, there's no way that you can deal with a victim of gender-based violence outside Department of Health. Because remember, police have a particular role different to the Department of Health. And we have a particular role different from the Department of Health. So the partnership there is not negotiable. Hence, I made mention of the fact that in those centers, there are all those departments because the responsibility of a Department of Health is right in the center of everything else. You won't be able to process any victim without giving a go-ahead and being processed by Department of Health. Remember, majority of time, our members got into those centers because fundamentally they are raped, and secondly, they are beaten up. So that alone demands a Department of Health for them to be able to say if there are anything that they need to deal with it immediately, which is always the case. They are the first to deal with the victim before anything else, because remember, all the process that gives police evidence that there is a case to be answered here will be provided by the Department of Health. So there is no negotiation whether Department of Health should be part of or not. It is compulsory because without it, it will be a complete distorted outcome, which means that there will be no one case we can win. Victim will not make it in the court because there will be a serious leaking of the fundamental evidence, and that evidence can be found and be provided by the Department of Health because no one walks in smiling into those centers. Everybody gets in a devastating manner because there is atrocities that would have happened to her body, and her soul. And that demands the Department of Health. So I want to assure the honorable member that it is not negotiable. Even the process that we are following at the present moment of workshopping everybody, who are doing that in partnership with the Department of Health, because they are the specialists when it comes to that. We come in for the later process. Police come in for even later one because they would want to know what then happened. And by that time, the victim must be ready to speak. The victim must have been ready to have been made it possible for her or him to present herself or himself to the police. Therefore, Chair, I want to assure the honorable member that partnership is not negotiable. It is compulsory if we want to deal decisively with the gender-based violence, because Department of Health is one department that is quite extremely important to be part of those. I thank you, honorable member.
Thank you very much, Honorable Minister, for well articulated responses to the questions that were put before you by the honorable members. And accordingly, we have come to the end of your questions, and would once again take this opportunity and thank you for availing yourself to respond to the questions that are before you as proposed by the House. We wish you all the best in your endeavor, in your new responsibility, Honorable Minister. Thank you very much. You may take your seat. Honorable members. I see the hand, honorable member.
Thank you.
You're raising
Chair.
on.
Yes, thank you. I've waited until now let the Honourable Minister finish and let you speak. Honourable Chair, I rise on Rule 61, 1A. And it's very sensitive what I'm going to say now, but before the Honourable Adriaanse spoke, sorry, you said, and I quote, "Oh my God, what am I doing to you?" Unquote. And that, as a Christian, I'm a Christian, and millions of viewers today are also Christian, that is offensive. So I request that it be referred to the Rules Committee. If I heard wrong, then I will apologize, but that's what I've heard.
Can you repeat yourself? Speak closer to the mic, please.
Ma'am, Chair, you said, "Oh my God, what am I doing to you?" That's what I've heard. If I've heard wrong, then I will apologize and withdraw. That's what I've heard. So maybe Hansard can give us guidance.
So what?
Yes, but it's offensive to me as a Christian. It's subjective. It's
No,
offensive to me.
honorable members, can we please be orderly? I'm still trying to ascertain. Honorable member, you can please proceed because we want to capture you correctly.
Yes.
I said, "Oh my God, what am I doing to you?" And what is the point of order on that?
It is offensive language, and I want to
Is
know
it offensive?
Yes. To say, "Oh my God," is offensive.
I'm a Christian, unfortunately, so I don't see anything
still-
offensive by calling God.
It's still
So-
offensive to me as Christian. May we get opinion if it is parliamentary to use those words.
Honorable member, I think I get you now very well what you are saying, I don't know, you are suggesting that we take this to the member's privilege?
No, Chair. Chair.
Yes.
Freedom to believe.
No. he's raising in an orderly manner. He is us requesting to speak, and I'm affording him an opportunity in terms of the rules. Over to you, Honorable Chief Whip. Honorable Member, I will come back to you because I need to get this properly so that we rule accordingly. Over to you, Honorable Speaker.
Chair, what the member is not pronouncing explicitly is as to whether it's the assertion that the chair is blasphemous or not. But I think what is quite critical is to appreciate that freedom of religion include various forms of religious beliefs, and it also includes freedom not to believe. So it's a very sensitive matter. I don't think the intention of the chair was to be blasphemous. So therefore, the issue of referral of the matter to the whether it's Path and Privilege or the Rules Committee, it's a matter that probably, I think, given the fact that for the first time we have this kind of situation, I suspect it's a matter that we can probably have a reflection on and get us just as whether is the member saying that the chair is blasphemous or not. Thank you.
Yeah. Thanks, Honorable Chief Whip. Can I then revert back to the speaker so that I get a gist of the matter properly? Because I really want to capture you correctly. Where exactly are you taking us in this regard? Because to me, personally, it's a compassionate sentiment that I am giving to her, given the fact what happened earlier on, and I sympathize from that aspect. So I don't know what is offensive about that. So, and religiously, my belief, I'm a Christian, and I couldn't have said, oh my Satan. I couldn't have said that. So really, because I don't believe in that. So it is my religious belief, and I've got the right to a freedom of speech in that regard. So, but then I don't want to drown you, Honorable Member. I also want you to explain to me properly so that I understand exactly what is it that we are ruling on here.
Yes. The rule which comes to mind now is nemo juris in sua causa, which means nobody can be the judge in their own case. So I'm not going to ask you to rule on what I'm saying. I ask that it be referred to the Rules Committee to determine if A, the words, oh my God, is parliamentary language, and B, I say it is offensive to me and it's subjective.
Oh, okay.
To me,
Now I get you.
millions of other people.
Now I get you, Honorable Member. Okay, now I get you. Definitely, we will then, there's a point of order by Honorable Mananiso. You're rising on order, which rule, Honorable Mananiso?
I'm raising on the point of order in terms of what has transpired, just to indicate that for me, one believes that when we are in this house, the constitution as well must apply. So I think I fairly believe that when you said that you sounded not offensive as a Christian.
Honorable Mananiso, can you please take your seat? Honorable Badenhorst.
Honorable Chair, Honorable Badenhorst can raise a point of order before the chair rules. 69.8, Chair, says no other delegate may raise another point of order before the presiding officer has ruled the first point of order.
Honorable Badenhorst, you are doing one and the same. You are doing one and the same.
I have to draw your attention to it, Chair.
Honorable Badenhorst, you are doing one and the same. But nonetheless, Honorable Member, allow me to take this matter forward. I think I've captured the gist of what the Honorable Member was saying. We must accept that we are from different backgrounds, different beliefs, different religions, and accordingly, Honorable Farmer, Honorable Farmer, please don't allow yourself to be dragged into something else. We've heard you correctly, and as such, the matter will accordingly be referred, and determination will then be made in the next sitting. I think we close it as that. Honorable Chief Whip.
I wanted to suggest, Chair, that probably let's listen to the answer together with the table, with the advice, probably in the next sitting.
Yeah.
Then we're able to give a proper advice because this is for the first time this matter is raised. And South Africa is a free country, freedom of religion, and therefore it only makes sense that when we come back, having listened to the Hansard and the advice from the table, we are then able to give proper advice. Thank you.
Thank you very much, Honorable Chair. We are now moving on to the next order on the paper. We want to take this opportunity and welcome the Minister of Health, Dr. Aaron Motsoaledi. And having said that, once again, take this opportunity and thank you for availing yourself for this crucial sitting. We know the sector that you are leading is quite involved in terms of transforming the social livelihood of our communities. And accordingly, having you in the House is highly appreciated by the NCOP members. Having said that, Minister, there are quite a number of questions that have been asked, are being put before you for response. The first one is question number 124, which is asked by Honorable Fennis. I'm now inviting you to respond to the question as asked by Honorable Fennis. Thank you.
Thank you very much, Honorable Chair. Yes, it is true that non-communicable diseases are becoming a pandemic all over the world. Special high-level meetings have been called to discuss the issue by the United Nations itself, even above the World Health Organization. Now, there are 5 risk factors to what we generally regard as non-communicable diseases. The risk factors is smoking, the excessive use of alcohol, lack of exercise, unhealthy diet, and air pollution. These 5 are generally regarded as risk factors. And coincidentally, the recognizable non-communicable disease are also 5. This is diabetes mellitus, cardiovascular diseases means the heart and disease of the heart and vessels. The cancers is chronic respiratory disease and mental health. All of them are affected by the 5 risk factors. Now, what interventions are there? Interventions are many and varied. The main one is health education, because non-communicable diseases are generally diseases of lifestyle. It's the way in which we live, so education is important. But the active steps we are taking, for instance, immunization. In 2014, we were the first African country on our continent to start vaccinating 9-year-old girls for the human papillomavirus vaccination, because it's generally believed that cancer of the cervix, which is one of the biggest killers of women, is caused by human papillomavirus. And so when you vaccinate them before they are sexually active, it is generally believed that many of them won't get this cancer when they become adults. We are also encouraging the issue of community health workers, but we have also enacted quite a number of regulations which have been gazetted. For instance, we have got a regulation on what we call trans fats, which are very prevalent in many foodstuffs, and they do cause problems in cardiovascular diseases. We have also passed regulations about foodstuffs that are consumed by infants. For instance, I'm sure you are aware that you no longer see adverts. Even in our clinic, you no longer find infant feeding formulas because they were found to be very problematic for young children. We also published regulations on the reduction of sodium in certain foodstuffs, because it was recognized that South Africans eat 4 times more salt than the body needs. And this obviously lead to high blood pressure, which leads to cardiovascular diseases, heart attacks, and strokes. So we organize with industry to regulate the amount of salt in at least 6 foodstuffs, including bread and brine in chicken, soups, and snacks. All of them have got more salt, and we've been able to regulate them in 2 tranches. The first tranche, I think it was 2016, and then the second one was 2019, and then we are monitoring that. Chairperson, I think, let me stop there because there are many other areas of lifestyle diseases. I mean, lifestyle ways in which we can control non-communicable diseases. Thank you very much.
Thank you for your reply, Minister. The opportunity reverts to the Honourable Finnis for a follow-up question. Honourable Finnis.
Thank you, Honourable Chairperson. Honourable Chairperson, through you, I just want to thank the Honourable Minister for the comprehensive response to my question. My question through the Honourable Chair to the Honourable Minister is, will there be any penalties for companies who transgress the food labelling requirements as proposed in the regulations? I thank you, Chair.
Thank you very much, Honourable Finnis. Back to you for a response, please, Minister.
Yes, indeed. The reason that the regulations were made and even gazetted was that any company that goes practices out of the regulations, there ought to be penalties. That's exactly the reason why they were regulated. In fact, on the issue of salt, we wanted companies to self-regulate because we thought they are mature enough. When we met them, that is about some 10 years back, when we met companies, the big ones said no. If we self-regulate, smaller companies are going to hide because they are not all that detectable, they are not obvious. And they said those of us who are big and very exposed and well-known, we're going to suffer. And they said the state itself must regulate so that whoever goes out of the regulations will be punished. So yes, Honorable Member, there ought to be penalties. But the biggest question, which is the biggest problem, is the capacity of the state to catch those who are perhaps cheating. For instance, I told you about the 5 very common foodstuffs that are consumed that have got a lot of salt. One of them is bread. You can imagine how many bakeries are there in the country. The other is brining of chicken. Brining meaning the salt water which is injected in chicken in order to preserve them. When you find a refrigerated chicken in a fridge, it looks very big. Part of the size is because it has been injected with massive brine water. And that brine water simply means salt water, which can preserve chicken. And if you find any of the people who are selling frozen chicken having brined more than the amount of salt, obviously it's punishment. The same as soups that are used every day, the same as snacks. All of those need us to pay surveillance, and sometimes somebody might escape our scrutiny. Thank you.
Thank you, Minister. We now pass an opportunity for a follow-up question to the Dr. Skierkogel.
Through you, Chairperson. Minister, your deputy's response to the NDC pandemic on the 16th of September 2024 included a call for collective action from all sectors of society, not just government. Whilst this is an indicative of your relation that government and its draconian unimplementation and unfunded NHI bill alone cannot attend to all South African needs, how will this collective action be achieved when you are continuously and aggressively vilifying private medical schemes who have the necessary resources to prevent, detect, and effectively manage NDCs? Thank you.
Thank you very much, Honourable Skierkogel. Your response, please, Minister.
Well, I don't know about the verification part of it, but what I do know, as a matter of fact, is that I've spoken to many medical schemes why they are not active in the field of prevention, because one of the biggest treatments of diseases, including NCDs, is prevention of diseases and promotion of health. And I've raised this issue. Take, for instance, out of NCDs, but talking generally about prevention, I have queried medical aids why they are refusing to pay for contraception. That is also prevention. They refuse to pay for a contraceptive pill, which may cost 60 rand. Then the young girl goes to fall pregnant. She commits a backstreet abortion and gets complications, move into ICU. It costs 100,000 rand and the medical aid pays. I have raised that with them, that I find it ununderstandable and unwise. That does not mean vilifying them. And so when you raise this issue sharply, it has got nothing to do with vilification, because the issue of primary healthcare is very important. The second issue I raised is the present healthcare system has to be changed, especially under NHI, to be primary healthcare, so that we don't allow people to start the health system at the top, but they must start at the bottom. By the top, I mean going to a specialist for a flu, or going to a teaching hospital for a minor ailment, when you can go to a primary healthcare sector, or when you can go to a GP for that matter. That is not vilification. These are the facts we raise very openly, and we'll keep on raising them. Thank you, Honorable Chairperson.
Thank you very much, Minister. Let's call on Honorable Soisa for an opportunity to ask a question.
Thank you, Chair. Minister, with the recent news that have come up in the Western Cape that there is a shortage of screening centers for diabetes, and diabetes has been one of the is becoming rife within Black communities, where the high unemployment rate of some of the families cannot ensure that their family members are actually following a proper diet as to manage the diabetes itself. In light of this, what measures have you put in place to ensure that patients have access to healthy food, or they do follow proper diets? Because what I can tell you is that in some of the clinics that I know of in Kimberley, they used to have food gardens, and those food gardens are not running anymore. The land is just standing there. The clinics cannot do that. So in light of the shortage of that, what plans do you have to make sure that patients do have access to healthy food, or they do follow a proper diet? Thank you.
Thank you, Honorable Soisa. Back to you, please, Minister.
Honorable Chair, allowing patients to have access to healthy food cannot only be something that is done by the Department of Health, because this is not only about patients, it's about all human beings. That's why, Chair, there is something called social determinants of health. There's also commercial determinants of health. Social determinants of health are things that causes ill health, but are lying outside the Department of Health. For instance, the issue of poverty, which may lead to people to eat unhealthy foodstuffs. It lies outside the realm of health. It's for everybody, it's for the whole of society. All that we are doing is to teach people medically what can cause diseases. But as to where do they get the commodities, it depends on the level of employment, it depends on the level of education, it depends on the social systems in their country, and many other issues which make people social well-being to be balanced. That's why in 1978, the World Health Organization defined health as a state of good physical, good mental, and good social well-being. And social well-being obviously talks about the things I've mentioned, education, transport, healthy food, and all that. So it's for the whole of society. And in fact, it's a very good practice that every piece of land, whether at school or clinic or at home, every piece of land must be used to plant vegetables. That's a very important practice we'll encourage. Thank you very much.
Thank you, Minister. The last supplementary on this first of the questions goes to Honourable Mokoena. Honourable Mokoena.
Thank you, Honourable Chair. Greetings to you and greetings to the Minister. My question is, what measures are in place to integrate mental health services into a broader strategy for combating non-communicable diseases, given the strong linkage between mental health and conditions like diabetes, hypertension, and heart diseases? Thank you.
Thank you very much. Back to you again, Minister.
Well, I do know that people with mental health do get comorbidities like diabetes, high blood pressure, which becomes even worse when people have got mental health. The correlation is not really physiological as such. It's because people who have got mental health, it will be very difficult, for instance, to sit with them, told about the do's and don'ts, don't smoke, you must exercise regularly, you must eat this and that. It becomes very difficult. So we are integrating them. In other words, in mental health institutions, the people working there must be painfully aware of the fact that they are not talking to the general population, that whatever they are teaching, they'll have to teach it more times and there'll have to be more surveillance than you do in the general population. Thank you very much.
Thank you, short and sharp, Minister. Thank you for that response. Minister, we now move on to question number 142. It was asked by the Honourable Nicholas Godsell and relates to the implementation of the NHI. Your response, please, Minister.
Honourable Chair, the member is referred to the National Health Insurance Act, Act number 20 of 2023, Section 49. For ease of reference, the section is quoted below. It says the chief sources of funding, 49.1, the fund is entitled to money appropriated annually by Parliament in order to achieve the purpose of the Act. Subsection 2 says the money referred to in subsection 1 must be appropriated from money collected and in accordance with social solidarity in respect of 1, general tax revenue, including the shifting of funds from national government departments and agencies and the provincial equitable share and conditional grants into the fund. Subsection Roman figure 2 of that subsection, reallocation of funding for medical scheme tax credits paid to various medical schemes towards the funding of national health insurance. Roman figure 3 of that subsection, payroll tax, employer and employee, and surcharge, and the last one, surcharge on personal income tax introduced through a money bill by the Minister of Finance and earmarked for use by the fund, subject to Section 57, and B, calculated in accordance with the estimates of income and expenditure, etc., etc. Once appropriated, that's subsection 3, the revenue allocated to the fund must be paid through a budget vote to the fund as determined by the agreement between the fund and the minister and subject to the provisions of the Constitution and the Public Finance Management Act. On the issue of austerity measures in relation to NHI, Honourable Chair, austerity measures instituted by National Treasury impacts on all activities and programs of the state and its department, not only to the National Health Insurance. Even the work of Parliament is negatively affected by austerity measures, such as Parliament's inability to perform some of the activities that it has planned because of austerity. Nonetheless, the department continues to work with National Treasury to prioritize investment in health infrastructure, to sustain human resources for health, and to protect key healthcare services. Thank you very much.
Thank you, Minister. Honourable members, Honourable Gottsal has been granted leave from the House today and has formally appointed Honourable Adriansa to ask the supplementary question in his stead. The opportunity then passes to Honourable Adriansa.
Thank you, Honourable House Chair, Chief. Honourable Minister, due to bad policy choices, the cost of living in South Africa is already literally killing our people. So too is the failing public health under ANC governments. Thinking of Mafeking, Helen Joseph Hospital being prime examples. Why would the inevitable higher taxes, which would be the nail in the coffin for many poor and average South Africans, address this when the ANC government could not produce a proper model in 30 years?
Thank you, Honourable Adriansa. Over to you, Minister.
Well, Chair, I don't know about inevitable high taxes. I don't know where that comes from. As far as I know, I've been in this government for 30 years now, since democracy. I don't remember the last time we increased taxes. Various ministers of finance who present and gone have tried their best to avoid increasing taxes. And I'm not sure why there's a belief that taxes are going to be increased. These are the stories that are going on by people who want to criticize NHI, to threaten the public that there's an increase of taxes. But that is not inevitable, and we've never said that's going to happen for sure. So I'm not sure where it comes from. On the issue of public health infrastructure, yes, we are meeting with Treasury. We know hospitals like Helen Joseph, but not all our hospitals look like that. We know our hospitals like in Mahiking, but there are hospitals that are first class in the country and are run very well. Thank you very much.
Thank you, Minister. The next opportunity falls to the Honourable Mokwele.
Ke o leboge modulasetulo ke dumedishe molekgotla wa tša maphelo mo Parlamenteng ya Afrika Borwa. Molekgotla wa tša maphelo mo Afrika Borwa, la mathomo ke rata go leboga the National Health Insurance yeo ke tsebang gore e tlo gola batho ka moka mo Afrika Borwa, kudu batho ba dikobo di khutshwane le batho ba ile gore ba mo magareng. Minister, puso ya ka e kgolokgolo kudu mo go maloko a palamente le maloko a di palamente tša ko di provinceng. Ko gore le maloko wa re tswela pele go ba maloko a skema se re bitša ke medical aid o ba reng ke permit wa o tura kudu o ile gore in the main ba re ke medical aid wa maemo a godimo while le gona le lenano le le botsele le tudi ya batho ba Afrika Borwa ka moka ba kgone go fumana ditirelo tša maemo a godimo. Ke puso ya ka molekgotla wa tša maphelo mo Afrika Borwa, ke a leboga modulasetulo.
Thank you, Honourable Mokwele. Honourable Minister, your reply, please.
Ka nnete lekgotla la lenaneo la NHI, National Health Insurance, ke maetekelo a puso a go hlagiša seo lefaseng ka moka le se bitswang UHC, Universal Health Coverage, ya gore motho o mongwe le mongwe wa phelang nageng e itseng o tshwanetse gore a be le maphelo a makaone, good quality health care, mo e leng gore ge a hwetša maphelo ao ga a šašarekanye taba tša ditšhelete tša gagwe, selo seo ba se bitsang catastrophic healthcare expenditure, ka gore go ne le batho ba bantši not mo Afrika Borwa fela lefase ka moka tšekelele ba e le gore ba phela bophelo jo bo itseng jo bo kaone fela ka baka la gore o mongwe ka gae o ile a bajwa ge go nyakega ditšhelete tša go mo thuša. Lapa leo la safara go feta tekanyo ba be ba fetša ba le bodiding. Taba eo e bitswa gore ke catastrophic healthcare expenditure, gomme e nyaka go thibiwa. Mo go potšišo ya lenaneo la permit, nna mengwaga ya go feta ge ke le ka mo go health ke ile ka tla mo parlamenteng ke tlo kgopela gore nke ba lebelele taba ya gore maloko a parlamente a ntšhiwe mo lenaneong la permit, re mpe go tšwenwe medical aid o moswa ge National Health Insurance molao wa nna o sa diriwa. Mabaka a ka e be e le gore le a tura lenaneo la permit, and lebaka la gore le ture a se lebaka la go makatša. Insurance ka tlhago lefatsheng ka moka go bolela ka insurance o bolela ka batho ba bantši ba kenella kopano e itseng gore ba kgone go thušana. Modulasetulo go o ka tsenela insurance ya bophelo nto e re bitsang life insurance ya batho ba 10 fela go o tlhokafala ga o tlo hwetša selo ge e le gore batho ba joinetse insurance eo ke ba 10 fela go nyekega diketekete go fitlhela go dimilione. Jwale permit le gopole gore ke lekgotla la maloko a palamente fela le batho ba re ba bitsang judiciary di-judge tša naga ke bona fela ba joinetseng lekgotla la palamente go ka ba bala ba lekana sekete goba go feta gannyane goba ka fase ga sekete. So lekgotla la mohuto le a tura go ne gore le se ka la tura ke ka baka le le rutulelang ka kudu.
Minister, please conclude.
A ke le thege ke a leboga.
Ke a leboga. Minister, thank you very much. Your time had expired. Honourable members, before we move on, I'd like to take an opportunity to just welcome our visitors. We've got a group of visitors that have joined us in the gallery today, so welcome to all of you. This is the National Council of Provinces. Today we are busy with a session of questions to the Health Minister, Dr. Aaron Motsoaledi. So you are most welcome, and we will keep you informed of the processes as we go along. Thank you for joining us. Ladies and gentlemen, the next opportunity for a follow-up supplementary question passes to the Honourable Makasine from the EFF in the Free State. Honourable Makasine.
Thank you, Chair. Minister, the NHI will see the payment of services being administered by the National Fund Pool of the NHI. This system is unsustainable, as we have seen with the numerous programs that has been messed up because of the corruption. Can you be trusted with our public funds that will be safe in your good hands? Thank you, Minister.
Thank you, Honourable Makasine. Can we have your reply, please, Minister?
Well, it's not me who will be having NHI in my pocket, such that the question is asked whether I can be trusted. But on the issue of trust, I just want to remind the honourable member, I've been a Minister of Health from 2009 up to 2019. I moved over to Home Affairs from 2019 and back to Health. From 2009 to 2019, I'm challenging the honourable member to come with any evidence or any statement that was ever made about me having done something that is corrupt or irregular or illegal with money. I'm challenging that member. You can peruse all the media, peruse Parliament, peruse everything. I stayed there for 10 years. Never did anything, was ever anything mentioned about malfeasance that was practiced by me with money. But having said so, this is not about me. NHI is lifelong. It's not about one individual. It's about the whole country. As to which people do we put to be in charge of the fund and how the fund is administered, all of us, including Parliament, must have a very good say because these are public funds. And it is within our reach and within our capability to make sure that we put things in a way that there are various checks and balances such that such funds are not easily misused. Thank you very much.
Thank you, Honourable Minister. Let's proceed now to the supplementary question that will be asked by the Honourable Van den Berg from the Freedom Front Plus.
Thank you, Chair. Through you. Minister, the compensation fund could also be viewed as a mini NHA. But there is a serious shortage of qualified nurses able to do the basic assessments needed to qualify and quantify a claim. Will the same not happen to the NHI? The question I should rather ask you, since it's clear that the department will not be able to provide enough funding, not even from a massive increase in taxation, will be, how will the department then establish cooperation between the private and healthcare sections to finance the main drive to offer good, accessible healthcare to all people of South Africa without achieving these financial and service delivery goals? Is the NHI not just another election gimmick? Thank you.
Thank you very much, Honourable Van den Berg. Minister, do you have a reply?
If NHI is an election gimmick, then the whole world is engaged in an election gimmick, because the issue of universal health coverage has been debated and passed by nations under United Nations some times back. And we were there as South Africa, we were signatories that yes, we support universal health coverage. More than that, the recent Sustainable Development Goals, which are up to 2030, also encourages the issue of universal health coverage, which in South Africa we call NHI. It is goal number 3.8 of the Sustainable Development Goals of United Nations, the goal of universal health coverage, which said the healthcare financing of nations, each and every country, must be in such a way that people are treated for diseases regardless of their socio-economic status. And when they are so treated, they must not experience financial hardships like catastrophic healthcare expenditure. I am surprised, Chair, of people who speak like this and keep quiet when injustices are done. Last week or 10 days ago, there was an article in News 24 of a reverend in the Eastern Cape who is now sitting in the Western Cape now waiting, who has been paying for a medical scheme for 30 full years, paying a premium. He now has got cancer and it costs 1.4 million rand to treat him because doctors said he needs immunotherapy. And the medical scheme is refusing to pay. They say that's very expensive. Who must now treat him? Obviously, he is going to come to the public sector for us to treat him. Quite a number of people who go to private hospitals because they are on medical aids, and some of them are sitting in ICU, and they run out of money, they are released. Even from ICU, they are released. We've got several examples of that. That's the issues we are fighting, not private healthcare as such, but some of the practices, in the same way as there are practices in public healthcare, which we do not like, which we want to change. If they are practicing private healthcare, we'll call them, we'll show them. And that doesn't mean that we are fighting private healthcare. And I, for one, am against a situation where you take your money or medical aid, go to spend it there. When it runs out, you are kicked out, even when you are still need care under ICU. Surely we cannot turn a blind eye to all those things. So the propaganda that in NHI we want to do away with private healthcare, it's not in the act. If you go and read the act, please speak to the facts. Go and read the act and show us the portion which is saying that. Thank you very much.
Thank you for your reply, Minister. That concludes the question 142. We now move on to question 126. Was originally asked by the Honourable Baines from the Western Cape ANC, and it asks a question relating to patients at the Helen Joseph Hospital. Honourable Minister, if we can have your response to the question, please.
Yes. Honourable members, immediately after that very widely circulated video went out, which really broke our hearts, immediately after it went out, I, as a minister, wrote to the health ombudsman and asked him to immediately investigate the veracity of the allegations about the bad treatment of patients, because coincidentally, I'm the one who established the office of the ombudsman when I was in health for the first time. And people were asking, what is the ombudsman? What is the meaning of the whole ombudsman? What does he do? My simple answer was that it's the office of the public protector of health, because healthcare system needs to be protected. And that's exactly what we did now. That to protect the healthcare system, we call the ombudsman. But while waiting for the ombudsman, the Office of Health Standard Compliance, which was also so established, also went there. In the meantime, while all these reports are awaited for, the Quality Improvement Directorate in the Department of Health also went there, was sent there, and the team was sent there, and they started talking about the general improvement of quality of healthcare, whether investigations are going to prove or disprove the allegations that were made. But we thought it's important to speak to the people. about general character and behavior towards patients. The Gauteng Department of Health also went there and started a campaign, launched a campaign which is called I Serve with a Smile. If the veracity of those tapes are proven, if something is done by a doctor, we've got a statutory body, the Health Professions Council of South Africa, that registers doctors, can also take them to DC and deregister them. If it's a nurse, we've got the South African Nursing Council that registered nurses and they deregistered them. But while this video was on, we happened to have been in a Bosperat or a retreat with all MECs for health, and we asked them to go back and look into the issues that we saw on that video, whether other hospitals are suffering a similar fate or not. And on the 28th, we'll be finalizing the issues, especially about things like bedding, sheets in hospitals, cleanliness, and all that. Thank you very much.
Thank you, Minister. The first supplementary will come from the originator of the question. Honourable Baines, it is your opportunity now.
Thank you, Chair. Good morning, Minister. Chair, through you to the Minister, I would like to ask the following question to the Minister. I would like to thank him for the thorough response to my question. The working conditions at the hospital might have played a role in the attitude of the staff in the hospital. Is the department also looking at the working conditions and the workload of the staff? I thank you.
Thank you, Honourable Baines. Honourable Minister, back to you, sir.
Oh, definitely, Honourable Member. Working conditions do affect the behavior of staff. I'm not saying that's the only thing, and exonerating people from good behavior if they've been trained. But indeed, if you are working in a very dirty, dilapidated place, your attitude really is not like somebody who is working in a well-managed and good environment. So the environment under which human beings work also influence their behavior. I did see that in practical terms in King Edward the 8th Hospital, where, because I also studied there, where a block called Block N was renovated when the other blocks were still due for renovation. When they finished that block, the staff working in that block really changed their behavior in terms of late coming, in terms of going for lunch for a long time, in terms of the way they speak with patients. Well, that's true. It's something that we cannot run away from, though it's not the only determinant of behavior. And that's why a month ago, we went to sit with Treasury to discuss such issues about money for maintenance of our facilities. Because if you look at private hospitals, they've got very good facilities, they've got very good infrastructure, they've got very good equipment, and people working there, you can see them from their behavior. Even the same staff, there are quite a number of nurses who go to do what is called moonlighting, who work in public hospitals, and they also work in private. And their behavior towards patients in the private hospital is completely different from the behavior when they arrive in public hospitals. It also happens in education. It's not only in health. I was once an MEC for education, a teacher who was teaching under a tree in a very, very far removed area. Their character and behavior differs if you put them in town, in a school with laboratories, with everything, with a kitchen, with everything that a teacher ever needs. So it is true that environment affects the character of people and the manner in which they relate with each other. Thank you very much.
Thank you, Minister, very much indeed. The next supplementary will come from Honourable Sawisa of the EFF. Honourable Sawisa.
Thank you, Chair. Thank you, Minister. Minister, we need to be a government we need a government that is proactive and not reactive. We can't wait for things to happen and then there's going to be intervention that's going to happen. Our public hospitals are crumbling with many facilities in dilapidated conditions and lacking key equipment. The EFF has consistently advocated for improved health services and renewal of health system. Yet to date, we have not heeded the call. What recent interventions have you taken to improve the services offered not only in Helen Joseph, but in other hospitals as well? Because Minister, what I can tell you, every time we see more and more videos of poor service that is being rendered to our people, whether they go to hospitals or they go to clinics. Thank you very much.
Thank you very much, Honourable Sawisa. Back to you, Minister, please.
It is absolutely not true that we are not proactive. The very first question I answered in this session today was about some of the rules that we've made to regulate the way in which people live. We mentioned them, and that's being proactive. Secondly, on the issues you have mentioned, Honorable Member, about improving service and infrastructure, that's why we even established the Office of Health Standard Compliance, whose job every day is to make sure that health facilities comply with certain standards that have been set by the office. I've just given you the example of the Office of Health Umbad, which we established some years ago, specifically also to make sure that healthcare systems are protected. That to me is being proactive, not waiting for things to happen before you act. That is also shown by the program under infrastructure which we have developed to refurbish hospitals, build new ones, or rebuild those who are completely dilapidated. And we have got a list for those. Thank you very much.
Thank you, Minister. We now invite Honourable Farmer. Honourable Farmer.
Thank you, Chairperson. Thank you, Honourable Minister. South Africa is ranked 50th out of 94 countries on the 2024 Global Healthcare Index pertaining to the state of our public health facilities. However, South Africa also has some of the best hospitals and medical infrastructure available. What is the Minister's plans to close this wide gap between the service the poor receive versus those of the rich? Thank you, Chair.
Thank you, Honourable Farmer. Honourable Minister, back to you, please, sir.
That's precisely, Honourable Member and Honourable Chair, why we are coming with NHI, universal health coverage, to close the gap between the rich and the poor. It is true what we have said, because if you want to see gross inequality, you must come to the healthcare system in South Africa. It's grossly unequal. The World Health Organization has actually recommended that for citizens in a particular country to get good health care, that country must spend at least 5% of its gross domestic product on health. Now, in South Africa, we have far exceeded that 5%. We are at 8.5% of the GDP, of expenditure of health as a percentage of GDP. So what's the problem? The problem is how this money is distributed. 8.5% of the GDP amounts to 570 billion, which many countries do not even have. But the manner in which this money is distributed, 51% of it goes to only 14% of the population, and the remaining 49% goes to a whooping 86% of the population. Who is 14% of the population who have got an advantage of getting this money? Unfortunately, all of us honorable members of parliament, we fall within that category. All the teachers in the country on medical aids fall within that category. All the nurses, police, the army, the judiciary, people working in SOEs, all of them who happen to have medical aids fall in this category of 14%, whereby 51% of the total expenditure is spent on them. And when we bring universal health coverage, we are saying let the expenditure be distributed evenly among the whole population. Then you'll see a massive improvement in the healthcare system, even of the poor. Thank you very much.
Thank you, Minister. Honourable members, I think it's appropriate if you do ask the Minister a question to remain in the House until he has responded. I think it's highly disrespectful to leave the House before the Minister has responded to the question that you posed. Having said that, let's move on to Mr. Billy. Mr. Billy, your follow-up question, please.
Thank you very much, House Chair. Minister, you said that the Helen Joseph situation was an exception, but a 13-year-old disabled patient was assaulted by 2 security guards at the Ladysmith Hospital in KZN. Also at the Mahikeng Provincial Hospital in the Northwest, babies were being placed in cardboard boxes. Just over 900 babies died in Gauteng in the past 3 years due to neonatal ICU shortages, mismanagement, and inadequate infection control. I want to ask you, Minister, do you still think that this incident at Helen Joseph is isolated and an exception, or do you think this is a problem? Thank you.
Thank you, Honorable Billy. Honorable Minister, please respond.
I never said Helen Joseph is an exception. I did say there are bad hospitals and there are poor hospitals. And that's why we established the Office of Health Standard Compliance to tell us specifically which hospitals are good and which are bad. And they've got standards to measure that. That's exactly how we established the office, because we knew that they will never all be the same. But the issue of the behavior of doctors and nurses, as it was alleged, laughing at somebody who is dying, it's not something that is generally practiced within the healthcare system. As I am telling you, 86% of the population of South Africa is treated in public health care. There are those who made those unfortunate situations, but an overwhelming majority are treated and go home. Out of the 1.2 million women who fall pregnant annually, the private sector treats only 140,000 with all the resources. The whole 1,060,000 pregnant women deliver their babies in the public healthcare sector. It cannot be claimed that a majority of them experience those conditions that you are talking about, but we never deny that they do happen. Otherwise, if we did, we would not even have established an office that brings on standards like the Office of Health Standard Compliance and man it and tell them to visit hospitals to check standards and compliance. We will not have done so. We are doing so because we want all of them to be improved. Thank you very much.
Thank you, Minister. We now move on to question number 135. It was asked by Ms. Naledi Cherwa Mpongose from the Gauteng EFF and relates to the completion of delayed projects. Your response, please, Minister.
Honorable members, the following list provides a summary of projects that we currently have underway in each category in every hospital. Under the category of refurbishment of hospitals, in the Eastern Cape, 21 hospitals are undergoing refurbishment. In the Free State is 19 hospitals. In Gauteng is 26. In KwaZulu-Natal, 37. In Limpopo, 2. In Mpumalanga, 6. In Northern Cape, 2. In Northwest, 13. In Western Cape, 24. A total of 150 hospitals are undergoing refurbishment at the present moment. Those who are undergoing upgrades and additions, Eastern Cape is 10 hospitals, Free State 6, Gauteng 32, KwaZulu-Natal 50, Limpopo 19, Mpumalanga 7, Northern Cape 4, Northwest 9, Western Cape 16. A total of 153 hospitals are being upgraded and additions added. On the issue of new and replacement, that means a totally new hospital where there was none, or a replacement of an existing one that has gone old. Eastern Cape is 4, Free State is 4, Gauteng is 5, KwaZulu-Natal 1, Limpopo is 5, Mpumalanga 3, Northern Cape there is none at the moment, Northwest is 1, Western Cape is 4, a total of 27 hospitals that are new or replacement of existing ones is going on. Thank you very much.
Thank you for your reply, Honourable Minister. Honourable Farmer, the microphone behind you is somehow turned on. If you can turn that off for us, please. There appears to be some spirit activity in the house today. Welcome to the next lot of visitors in the gallery. Unfortunately, inappropriate football attire. We much prefer other teams, but you are most welcome nonetheless. The follow-up opportunity now passes to Honorable Chirwa Mpongosi. Honorable Chirwa Mpongosi.
I thank you for the opportunity. Minister, during NCOP week, the Gauteng delegation went from Rasterfal Secondary School and then to Kopanong Hospital. Both projects were incomplete. What was alarming is that during those engagements with the departments, it was brought to light that it was the same contractor that was responsible for both facilities in the different departments. Why is the minister not utilizing contractors who have a reputation for not completing projects? Why hasn't the department blacklisted these contractors? And what action has been taken against contractors who are notorious for not completing projects? Termination of contracts no longer suffices as sufficient and should no longer be cited as a consequence management tool. I thank you.
Thank you very much, Honourable Member. Back to you, Minister, for a response, please.
Yeah, Honourable Member, you are aware that at the National Department of Health, we don't issue any contracts for building of hospital in provinces. That is done by provincial governments, and we discuss this matter with them every time. We even have formed a CFO forum where CFOs are discussing with province, because one thing I want to concede is that contract management is found to be wanting. Once you give a contract, you must be able to manage it such that, as Honourable Member said, yes, if somebody is not able to complete, you throw them away immediately in terms of what is written on the contract. And if somebody is not good, you go to the Treasury and ask them to be blacklisted. So I will ask the Honourable Member to provide me with the names of the facilities she's talking about and the companies, if you have got them, or just the facilities will suffice. We would like to look at them. And if we find that they qualify for blacklisting, we will personally go to the Treasury and force the provincial department to take action against them, because it is not good for the public, even for the fiscus, for projects to be uncompleted. Thank you very much.
Thank you for that undertaking, Minister. The next opportunity passes to Honourable Skierkogel for the follow-up question.
Through you, Chair. Minister, the former Gauteng Health MEC, Brian Nhlonga, and other civil servants from the department are currently facing charges for receiving kickbacks, enabling foreign businessman Brian Payani to loot the department of millions of rands, despite his company not having the necessary skills and experience. How will the measures you have outlined today regarding delayed projects deal with this large-scale corruption, which is enabled from within the system by those who are politically connected? Thank you.
Thank you, Honourable Member. Back to you, Minister.
Honourable Member, the fact that you have named people who are now being charged actually shows that the system is working to identify such people. You yourself have named them and say such and such an MEC is being charged for this and that. And that to me indicates that the system is not asleep. You are aware that we also work with SIU to make sure that any corruption that is found within the healthcare system is actually dealt with. And to me, I'm satisfied that up to so far, we are dealing with these matters, and I'll call over members of the public to help us. When I was in Home Affairs, we depended very much on whistleblower, and you can go and ask them. There's no whistleblower who blew a whistle on something on which we never took action. We have fired quite a number of people. We've referred some to the NPA to be charged. We referred them to the Hawks, etc., etc. So we'll definitely not tolerate corruption. We try our best to fight it. Thank you.
Thank you, Minister. Let's go now to the Honourable Majola for a supplementary question.
Thank you, Chairperson, Honourable Minister. Thank you very much for your responses, in particular to understand that the issue of construction is not sitting into your department, but it's housed at the provincial government level. And also concurring with you, Honorable Minister, that the delay in project, it does not only violate Section 27 of the Constitution, which is the access to the quality health care, but it further also contributes to the wasteful expenditure. My question is, Honorable Minister, is that with your provincial departments using the IGR platform, do you have any specific monitoring and evaluation measures that the department has implemented to avoid the delay in projects? Thank you.
Thank you, Honorable Majola. Back to you, Minister, for your reply, please.
Yes, we do have such a unit at the head office that has developed a system which can actually try to evaluate and monitor what's happening. But as I'm saying, the problem still is that that tender has been issued by a provincial government, the person responds to them. But once our monitoring unit comes across a situation which is not as was agreed with the province, we do call them to the attention to that province that we have issued such a contract, it is delayed, and these are problems, and we're asking you to please take care of that. If it becomes worse in a province, honorable members, we know that we impose Section 101B or 1A, as we did in Northwest and as we once did in Limpopo. That's when you realize that things are not going according to the way they should. The Constitution allows us to impose those sections, the Section 100 of the Constitution. Thank you very much.
Thank you, Minister. The last supplementary on this particular question goes to Mr. Sibande. Honorable Sibande.
Thank you very much, Minister, for your sensationally profound articulation response. My question, has there been any improvement in the number of healthy care facilities since 1993? Thank you.
Thank you, Mr. Sibande. Your response, please, Minister.
I wouldn't know, Chair, what 1993 refers to. I'll really be confused about 1993, because you are aware that our term as a government started in 1994. And throughout that whole period of 30 years, there are areas of improvement. And of course, there are areas of setbacks. For instance, the improvement I can approve for since 1994 is that in 2014, when we celebrated 20th anniversary, we showed infrastructure that has been put in and proved that 40% of clinics in the country were built during the era of democracy. The other 60% were built 1994 backwards, maybe up to 1652. And we're able to put that, and we're able to show that in the first 5 years of democracy, that's when 800 brand new clinics were built. So there are those which became new, but there are those who deteriorated. That's why a short while ago, I was mentioning hospitals that are being refurbished, those that are being replaced altogether, because they've become so old that you can't even refurbish them, where we're building even new ones. Thank you, Honorable Chairperson.
Thank you, Minister. We move now to question number 144. It was asked by the Honorable Zed Ngobo from KwaZulu-Natal's MK Party. The question relates to unclaimed bodies in the mortuaries. Can we have your reply, please, Minister?
All bodies, honorable members, honorable chair, all bodies identifiable or unidentifiable admitted by the forensic pathology services, which we call FPS, are subjected to photography from the scene of death during the admission process into the mortuary and during autopsies. Photographs are archived electronically with a unique body number allocated by the forensic pathology services. Fingerprints were available, and I'm emphasizing were available because not everybody does have fingerprints. Fingerprints were available, are collected from all bodies, identified and unidentified, admitted to forensic pathology services, mortuaries, in collaboration with South African police services to assist with the identification process. The following process is usually observed. Fingerprints are captured on Form SAPS 192, and the SAPS investigating officers submit those forms at the local criminal record center and the Department of Home Affairs for identification process through available procedures that SAPS and Home Affairs do follow. The complicated cases, that means poorly preserved fingerprints or where fingerprints are unavailable because somebody might have lost their fingers or they might have been disturbed by harsh manual labor. The South African Police Service Victim Identification Center, called VIC officials, get involved to assist in the process. Forensic pathology services collect fingerprints for the death registration process with the Department of Health. Blood and tissue samples are taken from unidentified bodies also. The Department of Health is currently making efforts to get the unclaimed bodies to be identified. Failing this, formal legal processes will be followed because there are laws of what do you do with a body that is unclaimed after a particular period. Thank you very much.
Thank you, Minister. Would you like to ask a supplementary question, Honourable Ngobo?
Thank you, Chair. My Honourable Minister, I'm well answered. Thank you.
Short and sweet, hoping to catch a flight, no doubt. Let's move on then to the Honourable Mokwele. Honourable Mokwele, I believe, has moved online.
Ke o dumedishe modulasetulo. Ke dumedishe molokgotla once again. Molokgotla wa tsa maphelo puša ke kgolokgolo ke ono re ke leano le lefeng leo le nao lona go tliša bakarolo ba tšea karolo ka moka kudu ka taba yona e ya go garola matswalo ya baku ba rena bao ba sa humanego ba le gore a ba tsebege ke nyaka go tseba nna ke leano le lefeng le lore le na lona le le molokgotla go tliša batšea karolo ka moka mo tabeng e gore le lefapha le kgone go tšwela pele go dila ka yena taba e ya baku bao go sena go ba bona ba ba kgonang go ba identify. Ke a leboga Minister, and thanks very much Chair for affording me the opportunity. Ke yona puša ka. Thank you.
Thank you, Honourable Mokwele. Back to you, Minister, please.
Well, Chair, the underlying socio-economic factors must be addressed at societal level through engagement with role players by department, as I said, go šoma le maphodisa, go šoma le department ya COGTA, go šoma le department ya social development, ye le gore ke mošomo wa bona o mogologolo ka go etla mo tabeng tša mohuto, go šoma le makgotla go swana le bosalka gore ba kgone go re thuša because taba ya gore go ne le ditopo tše e le gore beng ba tšona ga ba di tsebe a se taba ya health fela ke taba ya bosetšhaba ka moka gore go phediwa ka mokgwamang bontši jwa bona batho ba ba sa tseweng ke ba e le gore ba tswa malapeng a e leng gore ke ba dikodi magetleng mo gongwe e sa le ba timela gale fela go ne le taba e nngwe gape ke nyakang gore maloko a e tsebe re ne le batho ba bantši ba go tswa dinaga mabapi ba e leng gore ba tlile ka mo Afrika Borwa ka mokgwa go se molaong ge ba etla mo go tša maphelo ba tšhentšha maina ke ka baka le reng ba identified. Nna ka bonna ke ne le di-example tše mmalwanyana mo re hweditšeng motho a swere pasa ya mo Afrika Borwa a ngwaditše ka leina le itseng fela ga a fetše o hlokafala e ba gona re kwang gore a se yena motho ka leina le a le ngwaditšeng ka gona. So batho ba mohuto ba le mathata ba bang ba fetšwa ba bolokilwe ka ona maina a rongao ge ba bo bona ba fitla sepetlele ba re be re le motlhaleng wa motho wa borena re hweditse le ro feletse mo sepetlele ge re ntsha list ya batho ba tlhokafetseng ka gare ga sepetlele ebile ba bolokile ga ba kgone go mmona mola ka gore leina la ngwadisitseng ka lona ga ba le tsebe a senke a ba botsa gore o ngwadisa ka leina le lengwe ke mathata a mang a re ne le ona ao that's why re a bitsa underlying socio-economic factors ke a leboga.
Thank you very much, Minister. The next supplementary question will come from the Honourable Du Plessis.
Thank you, Honourable House Chair. Honourable Minister, is the department actively pushing and not just promising to improve the dire conditions of the mortuaries in South Africa, or is the indignity of a failing health care system extended to the dead?
Thank you, Honourable Du Plessis. Minister, your reply, please.
Well, we have put up a team of experts who understand the issues of mortuaries, which is headed by somebody who is a very highly qualified pathologist to show us areas of improvements which are wanted within our mortuary system. And as we are talking about renovating hospitals, we are also busy renovating mortuaries because some of the hospitals do have the mortuaries, others are situated away from hospitals, but we are improving all of them. Thank you very much.
Thank you very much, Minister. The last supplementary on this question goes to Honourable Chirwa Mpongosi.
I thank you for the opportunity. South African mortuaries are currently in a state of crisis, Minister. They are overcrowded, unsanitary, and poorly maintained with inadequate support from government as is. How does the Minister plan to resolve the issues of interdepartmental cooperation amongst health, criminal justice, home affairs, and the police, and also the under-resourcing of NHLS that all contribute to the overwhelming backlog that is the case at this point? Please state all the steps that the Minister has taken prior to deal with this and also the future interventions. But also, Minister, as you do this, please subsequently also appraise us on how these interventions have been meaningful and will continue being meaningful for the future interventions in solving the crisis at hand. I thank you.
Thank you, Honourable Chirwa Mpongose. Back to you, Minister, please.
Well, Honourable Chair, I have mentioned the socio-economic factors that lead to overcrowding in mortuaries. I personally, some years back, entered a mortuary in Rustenburg and found a very large number of unclaimed bodies. And when we investigated why, it is to do with the newly opened mines in that area, which attracts people from all over the world. Some coming to work there, others coming to sell things that should not be sold, that are illegal, like drugs, others coming as criminals for whatever purpose without their families knowing that they are there. And of course, when they die, they are put in a mortuary. Nobody comes to claim them. That is one of the areas. But the issue of interdepartmental, I've just mentioned here, Honourable Member, how we work with SAPs, especially when it comes to mortuaries, how we work with home affairs, how health itself called all those people, because as I said, these are very clear societal issues to see together. And I've just mentioned how we have appointed a team of experts who understand everything about pathologies and mortuaries to come and sit with us. I'm not sure why in this case of mortuaries you are mentioning National Health Laboratory Services, which is a network of 265 laboratories in the country, which as far as I'm concerned, works very, very well. And they only experienced a problem a few months back when they were hacked. And those problems were soon resolved and they are still continue to work very well. It's one of the institutions that are working very well because they help to diagnose diseases when we send blood samples there or body samples for tests. Thank you very much.
Thank you, Minister. Minister, the final question and then follow-ups is question number 127. It was asked by the Honourable M. Feni from the Eastern Cape ANC. The question itself relates to the Listeriosis outbreak cases. Back to you, Minister, for a reply, please.
Yes. Chair, this question is about listeria that afflicted the country in 2017. The cases of affected persons by listeriosis during the outbreak in 2017 are dealt with by way of class action. In other words, there is a company, it's Richard's Poor Attorneys, that came and said they would like to litigate on behalf of the people who were affected by listeria. And obviously they were litigating against the company that was found to have been involved, which in this case was a subsidiary of Tiger Brands. As you know, we found listeria to have originated from the Enterprise factory, which is situated in Polokwane, in Limpopo. Now, our role as a government was to furnish the litigating attorneys, the poor attorneys, with the names and details of the people who were so affected. But apart from that, honorable member, the company Tiger Brands did approach me and they said they want me to help them to deal with the victims in such a way that there's no need to go to court, because the people who will end up benefiting from a shootout in court will be lawyers on both sides of the spectrum. That means lawyers who are litigating and those who are defending the litigation will be the beneficiaries, not necessarily the patients themselves. I agreed with them wholeheartedly, because it so happened that we're doing a sort of mediation in the mining sector when the same firm of attorneys, the poor attorneys, were litigating the mining sector for silicosis. We sat with them and did mediation, whereby quite a lot of miners were compensated for silicosis. And even up to now, we are still looking for them. They are still being compensated. So we agreed on this. Unfortunately, we came to learn later that the insurance company that has insured this particular company that is being litigated is refusing and out of, a mediation process. And so the matter is going to go to court very soon. And unfortunately, it's going to be a shootout in court. And we believe with that shootout, most of the victims might lose out, but we believe lawyers are going to come out being the most beneficiaries of such a shootout in court. Thank you very much.
Thank you, Minister. Honourable Feni, would you like to follow it up with a supplementary question?
Thank you very much, Honourable Chairperson. Thank you, Honourable Minister, for your response to my question. Honourable Minister, in a television interview, the Minister indicated that he would assist in resolving the impasse between the listeriosis victims and the company. What is the update on this intervention? And also, Minister, what will be the motivation and benefit of declaring listeriosis a notifiable disease?
Thank you, Mr. Feni. Your reply, please, Minister.
I've just told you the latest, that yes, we intervened and we're very happy about the mediation process, because we've seen the miracles, the good results rather, I won't call them miracles, but good results that were obtained in the mining sector when you do mediation. But as I've told you, we have just learned that the mediation is not going to go on because the insurance company is rejecting that approach. They want a shootout. Perhaps they believe that they might escape liability. Unfortunately, it will now be in the hands of judges. On the issue of notifiability, yes, listeriosis was not a notifiable disease. Listeriosis, called by Listeria monocytogenes, was not notifiable. A disease becomes notifiable, honorable members, when certain things are happening. Number one, when it suddenly changes in its character, in the manner in which we know it. And Listeria did so, because there have been cases of Listeria in South Africa for more than 40 years before the outbreak in 2017. That outbreak was a clear change from the character of Listeria, and it's one of the reasons that it got notified. The second reason that you may notify a disease, if it starts affecting many people with casualties or even fatalities, then you realize that this disease need to be notified. If also the disease is threatening to affect the economy of the country, it becomes notifiable. And lastly, if the disease or there's an indication that the disease may flow over the borders of the country, start affecting neighboring countries, then it also becomes notifiable. Thank you very much.
Thank you very much, Minister. Let's move to Honourable Peter for a supplementary question.
Thank you, Chair. A greeting, Minister. There has been reports on the prevalent food poisons from various food brands, which results to hospitalization and deaths of civilians, including the top score instant porridge from Namib Mills Company, which killed 3 children in Mdantsane in the Eastern Cape. What action has the department taken to hold these brands accountable for the loss of lives? What protocols are in place for quicker response to potential foodborne illness outbreaks in the future? And how does the department ensure readiness? Thank you.
Thank you very much, Honourable Peter. Your reply, please, Minister.
Honourable members, I'm sure you were all listening when the President addressed the nation about the steps that various government departments are taking. And you'll be aware that the issue of foodborne illnesses affect many departments, not only the Department of Health. The Department of Agriculture is involved, the National Consumer Commission is involved, Small Business Development, Department of Trade, Industry and Competition is also involved. But you'll be aware that in the cases of where fatalities took place, there are detectives from South African Police Service that are investigating. And if they found a prima facie evidence that somebody can be linked or a particular company can be linked to a particular death, then an inquest, they refer this matter to court, an inquest is held. Inquest court, their job is to find who is liable for a particular death and put various penalties. In other words, the inquest court are chaired by either a magistrate or a judge who must listen to evidence and find out who can be held liable for that action that led to somebody's death. And so those processes are on in the country, starting with SAPS investigating the matters and deciding whether there is an inquest that is needed or not. Thank you very much.
Thank you, Minister. Minister, penultimately, we now invite the Honourable Makasini to put a supplementary question on behalf of the Free State Province. Honourable Makasini.
Thank you, House Chairperson. Minister, the outbreak was the largest outbreak of Listeriosis detected in the world that affected thousands of people, resulting over 200 unnecessary deaths due to the neglect and carelessness of the lives of our people. What system have you put in place to assist to identify the early detection of cases so that to avoid what happened for future? Thank you.
Thank you, Honourable Makasini. Back to you, Minister.
Well, it was the largest at that time, but after our outbreak, you are aware that Australia also did follow and suffered an outbreak. The processes we put in place, number one, is to make Listeria a notifiable disease, which I've just mentioned the reasons, because hitherto it was not notifiable. Notifiability means if any doctor comes across a case of Listeria, they immediately report to government, such that within a period of 48 hours or so, we now know that there is Listeria somewhere, and we start watching whether there's going to be an outbreak or not. Something that was not happening before 2017 because Listeria was not notifiable. The second thing is we impressed upon district municipalities because they are the ones who are responsible for surveillance of facilities that are producing food, to make sure that they periodically visit some of these facilities to check whether things are still going well, whether there is no there's no invasion of the food by bacterial organisms or viruses or fungi. And that's what we are doing. And that's why even recently, with the present foodborne illnesses, the president has announced that will upgrade the issue of health inspectors to make them alert that they keep on checking premises. Thank you very much.
Thank you, Minister. The last supplementary for the day will come from Honourable Du Plessis from the Democratic Alliance and the Gauteng Province. Honourable Du Plessis.
Thank you, Honourable House Chair. Thank you, Honourable Minister. Thank you for sharing the lessons learned in 2017 with the Listeriosis outbreak. And as we know, prevention is better than cure. How then were these not fully implemented? And we recently saw multiple deaths of children thanks to Tuberfos in Gauteng because lax health and safety measures were put in place. Did we learn from 2017 and will this be repeated? Surely it should not be repeated. Thank you, Honourable Minister.
Thank you, Minister. Can we have your answer, please?
2017 was caused by Listeria monocytogenes, a living organism. The present situation, which is completely different, is that a chemical that is not supposed to be among people has invaded our communities. That chemical called Tuberfos, which is an organophosphate, which is used in agriculture away from people. Now, the Minister of Agriculture, Minister Steenhuisen, has just mentioned yesterday in a press conference, even this morning I was talking to him, that there are only 5 companies that manufacture Tuberfos, and that they were going to visit them to find out, after manufacturing the Tuberfos, how did it escape and was found among people to have caused this havoc. And he said they've even tested them, and they found that the Tuberfos that is causing problem was not manufactured in South Africa. It came in through the border somewhere, and we are talking to the Border Management Authority to be on the lookout if somebody is sneaking Tuberfos into our country. So it's a totally new situation, Honourable Du Plessis, which is completely different from what we experienced in 2017 with Listeriosis. So we are on the watch out that there is a killer in our midst, which killer is not supposed to be there. And that's why we're taking the precautions that the president has announced. And yesterday, we outlined them in a press conference. Thank you very much.
Thank you, Minister. Honourable members, I think we're all aware that the question session today comes from a question session that had to be postponed earlier on in this period. And I therefore want to appreciate everyone's attendance today, particularly the attendance of the Minister. Minister, thank you for presenting yourself to the NCOP. We look forward to seeing you again in person, but we do appreciate the fact that you took the time on a Friday to address the House. It is very much appreciated. Honourable members, noting that many of our colleagues did participate virtually, I think it's appropriate just to remind honourable members, particularly of this House, that when you are online virtually, please take the time to ensure that the correct background is loaded. There are many people to assist you if you don't know how to do it yourself. It has been circulated widely, and it is part of the decorum of the House to have that virtual background behind you so that we don't see things in the background that we don't particularly want to see. Honourable members, I must also remind members that the purchase or the procurement of a microphone greatly improves your performance when you are participating virtually, because it means that you can be heard properly, and I think that's ultimately what we all want to do. Honourable members, that brings us to the end of the day's business. The sitting is therefore adjourned, and I wish you all a good weekend. Thank you.
Bye-bye.
Recording stopped.
Thank you. Bye-bye.